Доброе утро всем, уважаемые коллеги.
Good morning, everybody.
About the young scientists. Мы начинаем нашу панельную сессию по молодым ученым. Разрешите пригласить на эту сцену членов конкурсной комиссии, профессора Куаныша Ергалиева, Альберт Пинхасов, Алишер Салиев, Павел Куран и Надежда Ермакова. Please. Good morning again. I'm glad to welcome you on the third day of our international summit. Я хочу всех поприветствовать на третьем дне нашего международного саммита. Today we have to work in the format of the youth forum with a participant of a large number from different regions, countries, organizations. So this format of work involves a competition, of course, among all 19 participants. All the section by our great competition commission. So I'm glad to welcome you, our competition commission, and we can start our panel session. The first speaker The first speaker is Moran Kochavi, MSc graduate, Department of Nutrition, Ariel University, Israel, with a report named Therapeutic Drug Monitoring of Antibiotics. Sorry, Quality of Life. Не изменили порядок. Попросили первым сделать.
So the order was changed, and he will speak the first.
Okay, so good morning, everyone. My name is Moran Kochavi, and I'm a dietitian in Israel. Today I will present you the findings of my thesis on the subject of quality of life and malnutrition in hemodialysis patients. Wait, okay. So I would like to start with the definition of end-stage renal disease. End-stage renal disease is the final permanent stage of chronic kidney disease. It's the stage where the kidneys can no longer function on their own. Therefore, the toxic substances and extra fluids are not being removed from the body. The patient must receive hemodialysis treatment or have a kidney transplant in order to survive for more than a few weeks. He will have to go through several treatments per week, being under medication permanently and under nutritional monitoring, and even be under the risk of complications before, during, and after every treatment. We're talking about over 2 million.
2 миллиона людей по миру, которые получают лечение по гемодиализу и после трансплантации почек.
And when we talk about the prevalence of malnutrition in hemodialysis patients, we're talking about the range between 18 to 75% due to the side effects of the treatments or nutritional restrictions. So, as I said, once a patient will have an end-stage renal disease, he will have to go through hemodialysis treatments. Starting the hemodialysis treatments usually comes with a damage to his quality of life and to his nutrition status. Therefore, the nutritional therapy will have to be an integral part in the whole treatment he will receive. A malnourished person will have more hospitalization rates, more infections, and higher mortality risk.
Excuse me, can you please be closely with the microphone? Yeah.
Okay.
Thanks.
We know that hemodialysis patients report a reduced quality of life compared to the general population. And we have to think, as the patient, he will take the totality of dimensions in his life when he thinks about his quality of life, in sickness and in health. So previous studies already showed the connection between the quality of life, the nutrition status, the depression, and malnutrition. But a study like that was never conducted in Israel before. So we wanted to examine the relationship between the quality of life indicators and BMI in hemodialysis patients, as well as the relationship between the quality of life indicators and the compliance with each of the nutritional goals the hemodialysis patient has, regarding energy, protein, phosphorus, and sun tube consumption. So in a cross-sectional study, we took 61 participants and we interviewed them to their quality of life using the EQ5D questionnaire, asking them about their mobility, their ability to self-care, meaning if they can get dressed by themselves or take a shower by themselves, their ability to do the usual activities like going to the coffee house or go to work, levels of pain and discomfort, and levels of anxiety and depression. We also asked them about their nutrition consumption during the last 24 hours. And I will go to the results. So we did not find any connection between the quality of life and the compliance with the nutritional goals, meaning a patient who consumed enough protein or enough calories did not necessarily have a better mobility or less pain and discomfort. At the next step, we divided them to the groups of malnutrition risk. And we were happy to see that almost 50% of them were in a minimal risk for malnutrition. But over 50% of them had some elevated risk for malnutrition in some level. Interesting thing we found was the minimal risk group and the moderate risk group had a higher BMI, they had higher rates of diabetics, and they gave a lower score in the EQ-VAS. The EQ-VAS is another part in the questionnaire where the patient will have to give a grade to his health status, health condition at that same point. The correlations that we found were that age was connected to the ability of self-care, meaning the older the patient, he had more difficulties in taking a shower by himself. Higher levels of hemoglobin in the blood were connected to a better ability to do the usual activities. He had more hemoglobin, he had more oxygen, and he was able to function better during the day. Higher fasting glucose in the blood was connected to more difficulties in their mobility, as well as elevated BMI, meaning the higher the BMI, he had more difficulties to walk by themselves. Elevated BMI was also connected to high levels of depression and anxiety, and to a lower score in the EQ-VAS, meaning the higher the BMI he had, he said his health is in a bad situation. We were trying to think about the connections that we found in some explanations, and we realized the mobility indicator was connected both to elevated BMI as well as to fasting blood glucose. Now, these two are connected to obesity and insulin resistance. The connecting dot between those two is obviously the diabetics. Now, insulin as an anabolic hormone will encourage the body to create more energy storages. Therefore, the patient will look overweight and maybe even obese, and he says that he doesn't consume enough calories. But we will see the truth about his nutrition status in the albumin levels, that even if they won't be low at the same point, they will decrease with time. What we can learn from this is that the elevated BMI does not necessarily eliminate the malnutrition, and we have to remember this when we treat the patients. Now, overweight and obesity are risk factors for the general population for metabolic and chronic diseases. But once a patient already has a chronic disease, like end-stage renal disease, the obesity even has a protective factor, what we call the obesity paradox. And it is even associated with decreased risk for mortality. Now, in hemodialysis patients, the obesity may reduce the effect of protein energy wasting, meaning the lack of the energy consumption and energy, and even delay the development of inflammatory processes and cardiovascular diseases. In our study, 80% of the participants with diabetics had an elevated BMI, and they were connected to the minimal and moderate groups of malnutrition. Now, let me remind you, these are the groups that said, my health status is low. Now, already studies that were conducted in hemodialysis patients with diabetics showed that they have a poorer mental health and lower physical function compared to hemodialysis patients without the diabetics.
1 minute left.
They even said they have a lower quality of life and more hospitalization rates compared to those without the diabetics, and they have a higher mortality risk. Now, if we must conclude, we can definitely say that the hemodialysis population has a unique needs, and they are in increased risk for malnutrition, and they definitely do not comprehend with the dietary recommendations. Now, even though we did not find any connection between the quality of life and the comprehension of the nutritional goals, we did find some connections between the quality of life and BMI and other biochemical parameters. And we must take this as under consideration when we treat those patients. Now, we hope these results will become the basis of future research under the subject of nutrition education for hemodialysis patients in order to improve their quality of life as well as their nutrition status. Thank you.
Thank you, Ms. Mohaves, for this brilliant speech. So, dear participants, you have the opportunity to ask for a speaker some questions. У вас есть возможность, уважаемые участники, задать вопрос нашему спикеру. Если вы желаете, можете поднять руку, и вам предоставят микрофон.
Thank you very much for excellent presentation. I have one question regarding the design of the study. Usually in the dietary interviewing, we use 3-4 days dietary recall surveys, right?
Yes.
But you have employed like 24-hour recall. Whether this method is validated, or can you comment on it?
Well, it is valid, and we know that we usually, it's better to take a few days of the nutrition consumption, but it was cross-sectional study, and we had to ask the same, to do the interview once in order to keep the consistency of the results.
Thank you.
Thank you. Do you have any questions? Yes, please show.
Please, can you define your own personal contribution to this work?
Well, at first I didn't know what to expect when I came to do the experiment, and at the end of the study I realized that the most important thing was to actually see the patient, because nobody is asking them about the quality of life. they're asking them about, yes, how they
He
feel.
asked,
But
what is your contribution? What you did in this study?
I'm sorry. Well, I did the interview as a dietitian. I took all the dietary consumption and I did all the calculations in the SPSS. I wrote the paper, the work, and it will become a paper.
First version of the paper, I guess.
Yeah.
Okay.
Right. I have a question.
Mhm.
What are the research questions that you are trying to address in this study?
I'm sorry, I couldn't hear.
What are the research questions that you are trying to address in this study?
We were trying to examine the relationship between the quality of life indicators like mobility and the pain and discomfort and levels of anxiety, and compare them to BMI and the compliance with the dietitian recommendation. Meaning if a patient who has a higher BMI will report a better quality of life, meaning he will have less pain and discomfort, he will be more happy, and has lower levels of anxiety and depression. But we did not find any connections.
Thank you. Dear colleagues, we will go forward. The next speaker is Medet Tolubayev, Associate Professor, Astana Medical University, Kazakhstan, with the topic Psycho-emotional state of doctors in Kazakhstan before the COVID-19 pandemic. Please. Dear speaker, you have 5 minutes for your speech.
Спасибо. В первую очередь, здравствуйте, уважаемые.
First of all, hello, dear participants of the International Summit. Let me thank all the organizers. My name is Medet Tolubayev. I'm the Associate Professor of Surgery Department. Today's topic, the psycho-emotional condition of doctors in Kazakhstan before pandemic COVID-19. The moral spirit or psychic state is the term which is frequently used in the industry, and it is defined with the following indicators. The first one, motivation, the syndrome of psycho-emotional
satisfaction,
and satisfaction,
depression symptoms. So doctors with the positive emotional conditions, so they have more qualified service, and it influences in a good way on their work, and
production
inadequate
affected with less resources, and is also connected with
professions, and staff is more qualified, and this is to certify that
and higher
many Kazakhstan citizens, they live
from Kazakhstan or go away from profession. Psycho-emotional condition affects not only the work conditions, but affects everything. It for hiring doctors increases, and it also affects security.
On medical safety.
Mistake increases. Can you please stay closer to the mic?
So the
quality of foreign publications.
Articles. So this question is really popular among international countries in healthcare. So, and it was obvious that emotional condition was not important, and resources supplement was not sufficient. And COVID pandemic, so there was a fact that the most important resource in medical sphere is human. So the aim of our investigation was the estimation of 4 indicators of psycho-emotional condition. The first one is motivation, satisfaction, burnout, and others. The materials and methods. So there was a searching of scientific publication in the next databases. such as PAM, Conrain Libraries, CAPAS since 1991. And you have 1 minute left. Now let me share our results. 112 resources were found. 35 articles were chosen. 17 resources were collected, and questionnaire which were applied. So you can see this list here. And now about conclusion. So according to our research, the situation is the next. So we have different levels of psycho-emotional condition in different regions, and researches were taken. So we cannot do common researches everywhere, and village areas are haven't been researched. So this investigation is a part of our scientific project, and in conclusion, psycho-emotional condition before COVID pandemic, so this indicator was on a low level. The satisfaction with this work is on the average and on the high level. And for better understanding of situation, it is necessary to hold investigations in different categories and groups. Thank you for your attention. Thank you for your report.
У меня есть вопрос. Так, у меня вопрос, несколько вопросов. Скажите, пожалуйста, какой же все-таки дизайн?
I have several questions. Can you say me what is the design of your investigation? Only one question? According to your question, so I can answer. So during our investigation, so there was narrative research was used with descriptive analysis, and including keywords were used. So such keywords like psycho-emotional condition, depression systems, etc. So we had different structures, and that is why we couldn't do systematic review, and we did only retrospective analysis. And the amount of respondents, so they were included only from particular areas. So this retrospective investigation, so there was also a questionnaire and interviews. So we have used mixed method, and the results are under the process. So you said that psycho-emotional condition is not popular and actual right now. So can you say where did you get this information and this statement, this expression? On the whole, the amount of investigation that were taken in Kazakhstan, so as I said before, there were 17 investigations in Kazakhstan for the starting from 1991 till 2000, and taking into consideration the small amount, so we came to a conclusion that the number of publications in this period were not so popular. So there were different scales which were used, but we didn't have special methods, and due to the small number, so we came to a conclusion that this question is not popular in our country. So this is only your conclusion, but in the beginning you showed that it was from somebody's investigation. So there was misunderstanding, I think. Thank you very much for your report. Take your seat and we continue our session.
Is CEO Birjan, head of the Department of Scientific and Clinical Works, Doctor and Master Studies, South Kazakhstan Medical Academy, Kazakhstan, with the topic Analysis Scientific Journals on Healthcare provided by the authorized body of Kazakhstan and Central Asian countries, Kyrgyzstan, Tajikistan, Uzbekistan. This speaker will join us with online. This is the second speaker on your list. Where I changed the name of the speaker, yeah, the second speaker. Yes, Alihan Jaksovik. This one. Пожалуйста, подключите презентацию.
Sil Birjan, can you hear us? Yes, I can hear.
Hello, dear participants of the summit, dear guests. Unfortunately, Alihan Altanhanoglu couldn't participate in the summit, and instead of him there is me. My name is Seyituljan Seyitulu. I'm from the South Kazakhstan University. I'm a PhD student. Please connect the presentation. You have 5 minutes for your report. And today we're going to discuss the analysis of scientific journals of healthcare submitted by authorized bodies of Kazakhstan and Central Asia countries, Kyrgyzstan, Tajikistan, Uzbekistan. Next slide. If we talk about introduction, if we look at many institutions in healthcare industry in Central Asia, like I said, Kazakhstan, Uzbekistan, Kyrgyzstan, Tajikistan, Turkmenistan, they are still developing. And in the nearest future, you will see in the next slides the different ratings, and I will show you the results. And our topic in our language, we took the different data, and in Kazakhstan we have the body, the Committee for Control for Quality, recommended by the Ministry of Education, and we have 8 journals in Kazakhstan, and along those journals we'll see the data for Kazakhstan, Uzbekistan, and Kyrgyzstan, and they can have different names in other countries, but anyways, I will present you the results. Next slide, please. In this slide, you can see the data. We took 30 journals, and out of them, in healthcare, there is data, and only one journal by Scopus we can analyze, and other journals, unfortunately, we didn't find data for Scopus. In Kyrgyzstan there is heart vessels and transplantation journal, but other journals are not in the Scopus list. Next slide, please. Here we will talk about details and methods about Central Asia data. It's all the scientific journals were taken, and 30 journals, they have their own websites, and for 30 journals, everybody opened their websites, and we analyzed all of them. Next slide, please. Here you can see some results of ours. Some journals have identified the shortcomings listed below, and in the number of journals recommended by general authorized bodies for Central Asia in 2022 is 253, and of these the healthcare is 30, and number of journals submitted by authorized bodies on the Scimago portal is 8, and these 30 journals are belong to Kazakhstan, and you have 1 minute left, and other journals are not in the list. Next slide, please. And about journals of Kazakhstan included in Scimago portal. And of course there are journals of Kazakhstan, but there are no journals relevant to healthcare. Next slide, please. About the Scimago portal rating. And out of 4 countries of Central Asia, Kazakhstan is in the highest place. We are ranked 73, and after us there is Uzbekistan and others. Next slide, please. And the last one is Tajikistan in the list. Next slide, please. We can see here the rankings of our neighbor countries of Central Asia. And here we will present you the analysis, and we will tell you about the shortcomings, and there are very few foreign reviewers, and for example technical reviewers or main reviewers in Scopus and other publications, there are very few in their publications. Next slide. After that, another shortcomings in the social networks, these journals, even if they have their main pages, but they don't keep it, they don't maintain, they just put 2-3 posts and that's it. And they say that we have our website, but they don't maintain, they don't update it in proper time. And some journals, if we look at their archives in 2008 and 18 and 19, and there are links, and 30 years ago and 40 years ago data is published, the literature is very outdated. This is another shortcoming. Next slide. Your time is left. And here what I want to tell you. Our conclusion. All the journals you can find in the website, and some journals we can track online, but if in one journal found shortcomings, we cannot distribute to other journals. Of course, we need to consider different journals separately, and by identifying the common mistakes in separate journals, we can see the problems and shortcomings in the industry and in the journals. Thank you for a good report.
Good afternoon, dear colleagues. So I have a question to the reporter. So doing analysis, so what can you say about the small amount of journals of Kazakhstan in comparison with science and Scopus journals? And can you make any suggestions in connection with it.
Speaking right, as an example, if we take Kazakhstan, we have only 8 journals which are in the portal, and these 8 journals, they are included in our university list. If we take Nazarbayev University, there is this central journal, global journal, and it is also in global science list. But for Turkestan list, it is not there. It means, like you are saying, for Scopus journal, there are a lot of journals, but they are not in the Turkestan list. So there are a lot. If I answer your question, many journals, there are requirements for them. If we take the requirements, they are very strict, and for some journals to be included in the list, and for international rankings, of course we give our offers, and for Coxon sometimes we cannot be included. If we look at the list, there is international committee for medical committees. So there is a document, there is a rule, there is a code, and we are all based on this code. Anyways, many journals, sometimes they do not do proper actions and cannot be included. Just recently, Astana University journal was published in Coxon list, and like I said, actually it was excluded because they just broke some requirements of this organization. And before giving your application, first of all, you need to get acquainted with all the requirements, with all the conditions necessary, and after that you need to give an application. Thank you for your question.
We're running out of time. Thank you so much. Thank you. I would like to express my gratitude to the speaker, and we know that for our scientific activity, trying to find a journal is quite important.
Medical School of Nazarbayev University, Kazakhstan, with the topic Genetic Predisposition to a Habitual Miscarriage. Dear committee, is the third speaker in your list.
Yeah, if I may just ask, if all presenters will define what are the personal contribution to the work, just in one sentence, yes.
Thank you.
For the assessment.
Уважаемые спикеры, пожалуйста, в своем докладе.
Dear speakers, whenever you are presenting your works, please try to give one sentence of your contribution. And reminder to the speakers, please try to be close to the microphone.
Ladies and gentlemen, I'm glad to present in this early bird morning session, very rainy day. My presentation will be on genetic predisposition to the recurrent pregnancy loss. Recurrent pregnancy loss is the, according to American Society for Reproductive Medicine, is 2 or more consecutive pregnancy losses, whereas the European Society for Human Reproduction and Embryology and Royal College of Obstetrician and Gynecologists define it as 3 and more consecutive pregnancy losses. And due to these discrepancies in the definition, we have different prevalence rate of recurrent pregnancy loss among the world. So if we consider the recurrent pregnancy loss as 2 and more, then it will be about 5% of population and 5% of all pregnancies, and if we consider as the 3 and more, then 0.4 to 1%. So the recurrent pregnancy loss is very multifactorial disease, which has the many different type of factors, including modifiable and non-modifiable factors affect this disease, and such as maternal age, uterine pathology, genetic abnormalities, infectious agents, and endocrine disorders, thrombophilia. It can be hereditary or acquired, immune pathology, vitamin D deficiency, and other factors. And a number of recurrent pregnancy losses are idiopathic. I would like to elaborate more about genetic causes. Most often cause of the sporadic miscarriages, about 50 to 60%, is accounted for the chromosomal cytogenetic abnormalities. Also, the karyotype abnormalities of affected couple can contribute to the recurrent pregnancy loss. DNA mutilation, sperm DNA fragmentation is also known to be a cause. If we stop over the single nucleotide genetic variation, so there is now many studies, most of them being like just the hypothetical single nucleotide genetic single nucleotide polymorphisms, and the meta-analysis, which included like 472 identified variants, was linked with RPL. Among them, 21 variants was validated in European society, and 13 genes was validated in Asian populations.
1 minute left.
Okay, our study is aimed to recognize the novel genetic variants which can affect the recurrent pregnancy losses, and we are utilizing whole exome sequencing in this study. So whole exome sequencing is more relevant due to it covers only the protein coding regions of the genome. So it's ongoing study, but so far we have done only the epidemiologic analysis of the spontaneous pregnancy losses in Kazakhstan and some single nucleotide polymorphism studies. So according to our data analysis, we utilized the national database of electronic healthcare to calculate, and as you can see, like from 7 to 10% of the normal pregnancies will end with the spontaneous pregnancy loss. And also we have done the single nucleotide polymorphism study on FOXP3 gene polymorphism association. As you can see that the TACC variant was linked with the recurrent pregnancy loss, whereas the CGAC variant was mostly dominate in the control group. So this is it. If there is any questions, and regarding my participation in this study, I am the principal investigator of the study, and I participate in each step of the study. Okay.
Thank you very much for this great speech. Dear committee, we have the time for one question.
So may I, great work. I will ask you a little bit maybe complicated question.
Okay.
You mentioned here many different factors that may actually lead to the pregnancy loss. What you can tell us about gene-environmental interactions?
You mean the epigenomic studies done on the, or?
I will make it more simple. For example, you found correlation between specific gene and pregnancy loss. But it doesn't necessarily mean that this predisposition to specific mutation will lead to the pregnancy loss.
Well, yes, specific mutation will predispose to the pregnancy loss, right? We can use the example of factor V laden, which can be easily managed, right? You know, during the pregnancy, if it was like detected in the pregnant females. So if we use the anticoagulant therapy, so the pregnancy can be carried out normally, right? So this type of, so we are aiming basically to find the other possible novel gene variants but we just finished the first step of the whole exome sequencing, and the data is under analysis. So I'm sorry that I'm presenting not completed study, but yeah.
So what is your major message? What we may learn from your study? What will be the output for the society from your study?
Output will be the when we will probably hopefully we will find new gene variants probably, and we can see the subsequence of this gene polymorphism, and probably we can screen patients with the subsequent pregnancy losses for these factors, and probably manage it. Implicate treatment for this. So this is the main goal. This is quite a big, long-standing study, and I will continue to work over it.
Okay, thank you.
Thank you.
Thank you. Спасибо. Уважаемые коллеги, мы продолжаем.
Dear colleagues, we're going to start.
Associate Professor, Department of Engineering, Disciplines and Appropriate Practices, Kazakh State Medical University, named after Asfandiarov, Kazakhstan, with the topic Research Work of Students and Young Scientists of the School of Pharmacy of Kazakh State Medical University, named Asfandiarov. Please. У вас 5 минут.
You have 5 minutes. Good morning, dear participants of the forum. My name is Makhatova Baljan. I am the researcher at the university. I'm also the chairman of the Young Council of Researchers in my university. What is the relevance of the problem? So relevance is actually had been identified by the head of the state, Kassym-Jomart Tokayev. It had been noted in his decree, in his annual decree, where he had pointed out that the most important priority is the development of science, and one of the strategical resources of the development of science is young researchers. In a school of formation, we had established the Council of Young Researchers. We have 55 young researchers who are in this council with the degree of Doctor 10 and with master's degree 45. Why we have decided to establish this council? Because we would like to attract more and more young generations, primarily students, into the scientific process, and we would like to enhance the interest of young generations to the science, so popularize, let's say, science, and help young scientific scholars or scientists in finding the ways in order to solve the problem. So what are our directions? Is the development of the pharmaceuticals, drugs, pharmacognition is the research of the plants. Also, we would like to develop the full cycle of the manufacturing. I will be going through these images that you see on a web slide, and I would like to point out that if you would type into Google or any other search services regarding this If you would type in any of the Latin name of these plants, you would not see much of a material or information in order to identify what kind of plant are they. And you can see from our graph that since we have found our console, our publications had been increased, the number of the publications had been increased, or the presentations on the scientific conferences, the number of them had also increased, the patents had increased, and acts of the implementation had increased. For our scientists or young scientists are going abroad, they have won the scholarship Bolashak. They're not official participants here, but you can see them in the audience, which means that they are interested in science. If we will talk about achievements of our students, 30 students have been applying for participation in the contest for the scholarship of Shakhmardan Yesenev. 74 students had been participating in annual contest GXP Fest. 82 students had taken participation in a publication of the thesis in ASFEN Forum 2023. 20 awarding places had been taken by the students on international conferences for successful presentation with thesis. And I would like to show you photos that shows all our achievements.
Time for questions.
So, honestly, I'm very impressed. And little bit even confused. During 3 years, you were able to commercialize 3 projects. How you did this? Who helped you? And also, please elaborate what is your personal contribution in this, okay?
This is not only my work. This is work of a whole faculty.
Yes, yes.
This is a result of whole faculty. It is 55 young scientists, not only mine.
Mm-hmm.
We develop different kinds of substance, drugs, for example, creams, tablets, suppositories, and so on. And this is a long time to talk about it. I can say that it is a result not for 3 years, for 1 year. But this is work made for a long time. Firstly, we investigate plants, then we create substance, then we develop forms, different forms, and it takes from 3 to 5 years. And the result of this is commercialization. So 1 year, I think, it means that only publication results of our work.
Thank you. I just also have some requests from you. In this auditory is Professor Gary Gellerman, who is a great chemist. Mm-hmm. And he's working in this field for more than maybe 20 years, and he's not able to commercialize his projects. Mm-hmm. If you can help him, give him some tips what to do in order to make the project commercialized. So, Professor Gellerman, if later on, if you can share, they can help you.
We will be glad.
Поможете ему, да, немножко?
Конечно. Но у нас работает целый фонд науки, нам помогает.
Well, we have a fund of science. They're helping out. He has lots of PhD students as well. I think we can share our experiences. Thank you so much for your attention. This platform shows how, up to what extent we can find collaboration on this platform.
Next speaker is Dinara Galiyeva, Assistant Professor of Medical School of Nazarbayev University, Kazakhstan, with the topic Epidemiology of Type 1 Diabetes mellitus in Children in Kazakhstan. Dear committee, it's a 5th speaker in your list.
Thank you.
У вас 5 минут.
Yeah, thank you very much. Okay, so the research that I'm going to present is about epidemiology of type 1 diabetes mellitus in children in Kazakhstan. And I would like to say that this research was funded by the Ministry of Education and Science of Kazakhstan, and I'm the principal investigator of this research. So we aim to investigate and describe the incidence, prevalence, and all-cause mortality rates in children. So this is a pediatric population, children with diabetes, mellitus type 1, and we use the aggregated data from the Unified National Health Electronic System from 2014 to 2021. So this study was a retrospective cohort study, and we extracted data for children from 0 to 17 years old with diagnosis of type 1 diabetes mellitus who were registered in the system from 2014 to 2021. So to obtain the outcome data, we linked the registry data with the population registry through the RPN number. It's not changing. Ah, yes, okay. So we described the incidence, prevalence, and all-cause mortality rates per 100,000 population. The survival analysis we described using Kaplan-Meier plots and using Cox regression. So this is the flow chart of the extraction of the data. So basically we merged two databases, which is outpatient registry and inpatient registry. And then we excluded duplicate records. And the final cohort number comprised of 11,088 patients. So this is the baseline characteristics of the cohort. The mean age of diagnosis was, the median age of diagnosis was 9.87. So the follow-up was 3.85 years. There was a more or less equal distribution by sex, and there were more Kazakh children compared to other nationalities. So this is the incidence over the time. It slightly decreased during the time period, but more or less stayed the same. The prevalence increased during the study period. And this is the survival Kaplan-Meier plots. So we can see that younger children from 0 to 1 had lower survival rates compared to older children. Male patients, boys, had also lower survival.
1 minute left.
Compared to girls. And rural patients had lower survival compared to urban patients. This is the Cox regression analysis with the hazard ratios and 95 confidence intervals. So basically we investigated sex, age, ethnicity, and residency. So among all these risk factors, younger age, so only age showed the associated, the significant association. So patients with younger age from 0 to 1 had almost 4 times higher risk of death compared to older patients. So this is the conclusion. So incidence slightly decreased, the prevalence increased during the study period, and children from 0 to 1 years old had a higher mortality risk compared to older patients. That's it.
Thank you for this brilliant speech. Dear committee, do you have any questions?
So can you answer, so what? So once we have those results as public health experts and medical professions, what are we going to do with this information?
Yeah, so thank you very much for the question. So basically this is the secondary data analysis, and we try to utilize the registry data as much as possible for the research purpose. so we show that we are doing well with managing the diabetes because the prevalence, yes, the prevalence rose, but it showed that the prevalence is rising because we identify cases, we identify new diabetic patients, and the survival, of course, also getting better. So that's why, and we compared our findings with the international, the worldwide statistics. So we are in line with those data. So this shows that basically in management of type 1 diabetes in children, Kazakhstan is doing quite good. Yeah.
Thank you.
I just would like to add that great presentation, perfect presentation skills.
Thank you.
And you will have a great future.
Thank you very much. Thank you.
Keep going.
Thank you. Okay, thank you.
Thank you again.
Батасын беріп жатыр ғой енді қазақша дегенде.
Well, he's giving his blessings.
Такой очень добродушной норме.
On this note, we are continuing.
And the next speaker, Aizada Marat, Assistant Professor of Astana Medical University, Kazakhstan, with the topic Digital Learning and Digital Medicine. Dear committee, it's a 6th speaker in your list.
Қайырлы таң, құрметті әріптестер. Қайырлы таң.
Hello, dear colleagues.
We would like to present you our work that we have done. So our country is not the exclusion. In 2020, we decided to have a survey where we had identified the priorities where we could identify what are the main priorities of a healthcare of a country. And one of the priorities is the improvement of the perinatal assistance, which is the reserve of the Kazakhstan 2020. So the purpose of our research was to improvement of a quality of medical assistance through integration of the results into international quality science research works into daily practice, with the help of systematic joint discussions with practical, with in-service doctors, residents in online format. We have online journal club, which works 24/7, which has 24/7 platform. All of the doctors have free access to it. We also have online channel, the YouTube channel, where we save all of our lectures. We also post our lectures there. We also have social media pages. In 2023, Online Journal Club received its authorship certificate. We had, since the foundation of our club, we had conducted 23 sessions, seminars, and workshops. We also been attracting our teachers as well as the external experts from the Ministry of Healthcare to our work. The members of our club, in the frames of our program, is the visiting professor who had organized the cycle of evidence-based medicine in perinatology, and this cycle will start in 18th of September and will end 22nd September. This workshop also will be issuing certificates for 30 hours. The lecturer or the teacher or trainer of this training is international expert of World Health Organization, Associate Professor of State University Medicine and Formation, Moldova Stelikan Khodorodzeya. I would like to say that in the conclusion, it doesn't really matter how much of a resources do we have. It doesn't really matter if we cannot use them well. Thank you so much for your presentation.
Speaker.
Давай я задам, что-то все молчат, да. Скажи.
Well, I'll ask question. What is the main purpose of your research? Probably I misheard it, or maybe this presentation. Our aim is to improve the potential of gynecologists and midwives so that they could use updated data, so we decided to collect all the data so that they can use, and we also collected all the updated protocols, updated data, so that they could use this data in order to follow up with their researches. So this platform is free. Any person can register there and receive all the information that they needed on the YouTube channel. All of the we are recording all our sessions online in YouTube. It's not really a scientific project, is it? It's more or less, let's say, methodological support of scientific workers. Yes, that is correct. The support of the decree of the head of our state, as well as the capacity building.
Спасибо за ваш доклад.
Thank you for your report. Dear colleagues, let me continue our session.
PhD students in the Department of General Immunology at Vanguard of Kazakhstan Medical University, Kazakhstan, with the topic Anti-cancerous potential of wheat cell culture polysaccharides. У вас 5 минут. This 10th speaker in your list, dear colleagues. 10th. Сейчас 10.
Good morning, ladies and gentlemen. Let me present my work called Anti-cancerous potential of wheat cell culture polysaccharides. And this is important to mention that this work was possible because of first Bolashak scholarship, presidential, and Erasmus Plus scholarship. And it was done on the basis of University of Granada, Spain, and James Hutton Institute, Scotland. Let me first briefly tell about the importance of glycans in the cancer. Basically, glycans are signaling molecules, and they very important in activating EGFR, FGFR receptors, which are growth receptors contributing to cancer progression. And it's very important that glycans play a vital role in the hallmarks of cancer indicated by Hanahan and Weinberg. For example, P53, very important gene. CMYC is very important gene for cancer progression. And all of they are regulated by glycans. So our work was to identify whether the polysaccharides obtained from cell culture of wheat could be anti-cancerous. Therefore, we cultivated wheat cells, and then we cultivated them in suspension, and then with chemical extraction, we extracted 6 fractions and tested them on the colon cancer cells and also on normal colon cells to calculate further therapeutic index. Therefore, we had 7 fractions, and we showed very different effects of these fractions, and that was very interesting. One fraction was actually causing progression of cancer, which had completely different composition. We can see that it contains glucuronic acid and arabinose and galactose. Other fractions were differently chemically, and we can see that they inhibit cancer progression. Therefore, we had a very interesting conclusion about the glycan regulatory role in cancer progression. 2 fractions showed high therapeutic index, which tells us about the selective inhibitory activity of these 2 fractions exactly on cancer cells, while not touching the normal cells. Here we also can see we can see that they inhibit
Здесь также мы можем увидеть цикл ингибиторов или цикл клеток ингибиторов. И также мы можем увидеть, как же клетки аккумулируют NG1. Мы также не все фракции можем увидеть, поэтому мы провели через электронный микроскоп мы рассмотрели, как же они разделяются. И, если честно, у нас были неожиданные открытия, так скажем, маленькие. Мы можем увидеть, что многие деления активируются в внутренних и внешних путях, и это очень важно при клеточной ингибиторизации, если не ошибаюсь. И очень интересно увидеть дифференциацию
receptor, which is very important for cancer progression, and it also, this protein plays a vital role in differentiation. So we can see the dramatic decrease of this protein. Therefore, as a result, I will not read all of this, but what we found is that our glycans from domestic wheat plays a regulatory role in cancer, and most of them inhibit cancer growth. And it's a very interesting topic because we always think about proteins when we treat cancer, but glycans, they are more important in metastasis and cancer growth, and therefore we should learn how to regulate cancer by regulating microenvironment, and also this includes post-translational modifications. All of this, it's very different and difficult, and it needs to be investigated further. This work is in vitro study, and I hope we could continue by in vivo studies. Thank you.
Thank you for the excellent speech, dear committee.
May I ask you one question? I saw some quantitative data in your tables. How did you determine the content of particular proteins or compounds?
You mean research methods?
Yeah, analytical methods.
It's cell cycle assay and Western blot mostly. Protein quantification.
Protein quantification.
Yes. And electron microscopy allowed us to predict what we need to study, yes, what proteins we need.
Yeah. Thanks.
Yeah.
Thank you, Professor Pikhasov.
Great work. It's a lot of work you've done, and I assume that a study of many years.
Yes, it's like 5 or 6 years, many grants and scholarships.
I have a very simple question for you. You made a very serious statement that there is a fraction that have selective inhibitory activity.
Yes.
How did you came to such assumption?
Because we tested on the same fraction, the same concentration on the cancer cell line of colon cancer cell line, and we had normal cells. Then we calculated the concentration of IC50 and then divided those ratio. So they inhibit, when the fraction inhibit cancer cells, it doesn't inhibit normal cells. So I don't know what, so this is our results.
Perfect. No, you gave me a good answer. Thank you very much.
Because it was a search study. We didn't expect, but we were lucky to get this.
Good luck.
Thank you.
Thank you very much.
Thank you.
Thank you.
Really.
The next speaker is Asem Zhakupova. This is a postdoctoral scholar of Medical School of Nazarbayev University, Kazakhstan, with the topic violation of sphingolipid metabolism in hereditary sensory and autonomic neuropathy and glycogen accumulation disease type 1. Уважаемые спикеры, пожалуйста, говорите.
Dear speakers, please try to be louder. Come to the microphone a little bit closer. We have online participants. We want them to hear your message.
Thank the organizing committee to give me the opportunity to talk at this audience. I have to say that the title is actually Disturbed Sphingolipid Metabolism, and then before I get into that, I would like to give an introduction. So sphingolipids actually play an important role in cellular trafficking and, cellular signaling, and then they're integral part of the membrane. But if you look at the lipid distribution in plasma, in human plasma, I don't know if you see it. So sphingolipids take about 4%, but if you look at the variety of species found, so it's already 35%, so they're quite various species. And sphingolipid de novo synthesis, so newly made sphingolipids, it starts in the ER, and it starts by catalyzing serine and palmityl-CoA by the enzyme called SPT. And after a series of reactions, it results in the formation of ceramides. I'm sorry if you can see my pointer. Ceramides, and then more complex sphingolipids. Maybe you've heard of sphingomyelin or glycosphingolipids, and they're already synthesized in the Golgi. But this is the canonical pathway, so basically the condensation of serine and palmityl-CoA. This is the canonical pathway for the sphingolipids. But SPT sometimes takes alanine instead of serine, which results in these 1-deoxy sphingolipids that are atypical sphingolipids. What's so special about these metabolites? So basically, these point mutations in SPTLC1 and SPTLC2, these are the main subunits of the enzyme SPT. They were found to be disease associated with a rare disease HSAN1, and I'll get to that in a moment. But what we also found that these levels of 1-deoxy sphingolipids were increased in these HSAN1 patients. What is this disease? It's a rare disease. It's a HSAN1 stands for Hereditary Sensory Autonomic Neuropathy Type 1. And
1 minute left.
Sorry. Okay, so I'll just quickly go and just say that the patients develop, let's say, sensory loss in the stocking and glove fashion, and basically they have poor wound healing. And what's prominent about them is that, again, increased deoxysphingolipids in the plasma of those patients. But what's interesting is that this disease is actually similar to diabetic neuropathy, so similar let's say, manifestation, and also increased levels of deoxysphingolipids found in these patients. And we also looked at the plasma levels of deoxysphingolipids in metabolic syndrome and type 2 diabetes, and they were also elevated in these patients. And as majority of this work was done during my PhD, some part of it was done during my PhD, as an outlook, because I'm just starting a new position as a postdoc, so I saw that, so since these deoxysphingolipids were elevated in rare disease HSAN1, not so rare disease metabolic syndrome and type 2 diabetes, they will also most likely be elevated in age-related disease such as neurodegenerative disease, and possibly in NASH and NAFLD, so non-alcoholic fatty liver disease. So this could be this could serve as a potential biomarker. Secondly, this could lead to novel treatment for these patients. I know these diseases are not deadly, but it really hinders, it affects the quality of life for those patients, so possible drug interventions, and perhaps also explore other rare diseases that are similar to these neuropathies. So with that, I would like to thank for your attention, and thanks for the experts.
Thank you for a great speech, dear committee. Do you have any question for speaker? Пожалуйста, дайте микрофон.
Could you give him microphone?
Yeah, thank you.
Thank you very much. It was very nice. Just one question. Can you please explain how did you determine the sample size?
Yes. So basically, I know it's not a big cohort. So basically, in this study, in particular, there were only 25 patients, but this is quite consistent, and we measured those finger lips using the mass spectrometry. So, and I'm only showing this study, and I think this was done also in other studies that I'm not giving this. So I can't.
Do you think that 25 people is enough? I mean, you did any?
Well, this is a statistical. Of course, it's not a large study. So I believe I just can't remember, and I don't have it on the slide. But I think that we had a study that it is larger, and yeah, I would have to look it up. Yes, yes. But it's a good question. Yes, of course. Okay, yeah. Thanks.
Thank you for this question. Professor Pinkhasov.
Just great job. Great job, and I wish you good luck
Thank you.
In your journey.
Thank you.
Thank you. Our next speaker is Kamila Kokhabi. It's postdoctoral scholar of Medical School of Nazarbayev University, Kazakhstan, with topic autography in health and disease. У вас 5 минут.
Спасибо. You have 5 minutes.
Thank you, Bakhtiar, for introduction. Actually, my research interest in NUSOM is autophagy is in health and disease. Briefly, few words about autophagy. It's intracellular catabolic process which is lysosome mediated. So mainly it requires for clearance of damaged or long-lived cellular components, and it was shown that it plays essential role during development, differentiation, and the normal condition, and act as survival strategy during stressful condition. So large body of evidence showed that common human disorders are linked with dysregulated autophagic flux. So in my past research study, working in Weizmann Institute of Science, I was working, I had chance to work association of autophagy in neurodegeneration. So one of the hallmark of the neurodegeneration is accumulation of damaged mitochondria and protein aggregates that we could also observe in neurodegenerative disorders such as spastic paraplegia type 49 that lead due to the mutation in TECPR2 genes. In the experimental models that we had from patient fibroblast, and we could create mouse model that mimics this disease, we could recover the autophagic flux by autophagy inducers, and we could restore the autophagic flux by expressing TECPR2 gene only short time. So having background of experimental data and the knowledge, I came to the Kazakhstan and started to search what can I do in my home country. So I looked on statistics. So as you can see, in statistics, it was shown that breast cancer ranks as most common oncological disorder in Kazakhstan. So thanks for giving me chance to take cell lines of breast cancer from NUSOM database, where I could optimize the monitoring assay of autophagic flux.
1 minute left.
Yep. So that we can utilize it based on the data that by activation of autophagy via metformin treatment, it can induce and prevent tumor growth. So in a short time, I could succeed to get to, under my supervision, 2 master students that currently can work on the study to determine any autophagic effect during metformin treatment. And in parallel to check are there any changes during under-glucose availability. So I am also open for new collaboration, and thank you for the audience for listening and the organizer committee. Yep.
Thank you for your excellent speech. Dear committee, first of all, from you, do you have any question?
Can you tell us more about your personal contribution? What have you done in Kazakhstan personally?
In Kazakhstan, I could develop, optimize autophagic monitoring assay in breast cancer cell lines that can be used for future generation for different disorders which is relevant in Kazakhstan. Since neurological disorder is less diagnosed, so I can't apply it in Kazakhstan currently, but I wish I will do it in the future.
Great, thank you. From the auditory, maybe someone has a question for the speaker.
Thank you very much. I think it's a brilliant speech, and you explained everything. Do you have any unique methodology that you think can be implemented in different countries? I mean, maybe you use some methods in your research that can be implemented in future?
Like specific, no. But each cell types needs to be optimized to make sure that autophagic flux that we are monitoring is reliable.
Thank you.
You're welcome.
We'll go forward. Thank you for the speaker. Мы продолжаем дальше.
We're continuing.
Burska is postdoctoral scholar of Medical School of Nazarbayev University, Kazakhstan, with the topic Nanotechnology Enhanced Oxidative Drug Treatment of 3D Culture of KRAS mutant colorectal cancer cell lines. This seventh speaker in your list, Agata Burska. Please on your microphone. Please, but again.
Now? Yes.
Yeah, great.
Thank you for giving me opportunity to give this talk today. My name is Agata Burska. I would like to present our new project, recently granted, so we are just starting. Here the title is Nanotechnology Enhanced Oxidative Drug Treatment of 3D Culture of KRAS mutant colorectal cancer cell line. And this is our team of collaborators, Professor Dov Sarbasov, Professor Aidos Baumuratov, and Professor Veselin Paunov. I will be principal investigator on this project. A little overview about colorectal cancer. This is one of the global health problems and currently is one of the few leading causes of morbidity and mortality from cancer worldwide, and also increased incidence of colorectal cancer has been registered in Kazakhstan. Approximately 30 to 50% of colorectal cancers are known to have mutation KRAS gene, which is associated with their significant invasiveness as well as development of resistance to treatment. In this project we study arsenic trioxide and vitamin C. I'll be abbreviating ATO and VC, which are both FDA known, already approved drug and used for treatment. However, combination of these two drugs works synergistically and shows significant cytotoxic effect, selectively killing KRAS mutant cancer cells. Ultimate overall project goal is to develop novel therapies for KRAS mutant colorectal cancers with new nanoformulations for ATO-DVC that will work effectively in solid tumor environment. We will stimulate here the solid tumor environment by designing 3D culture model. Preceding studies published by Professor Sarbasov showed already that there is a difference between treatment with different isomeric forms of vitamin C. We have 1L form, which is natural form, and D form, which is the chemically synthesized form. Once we treat cells, colorectal cancer cells, HCT116, it showed the significant impact on the cytotoxic impact on the cells. We can see it as red and orange bars. This was independent initially on whichever isoform we are using. However, xenograft tumor models in nude mouse showed that DVC combined with ATO actually reduces tumor weight more significantly than form L. This study was validated, was reproduced using pancreatic adenocarcinoma cells here in NLA with similar results. Our main aim of the project is to determine how really arsenic trioxide and DVC combination leads to this cytotoxic effect. We know that it affects mitochondria because we know it induces oxidative stress and ROS production, but what the particular mechanism is unknown. We will use here first to try to assess how mitochondria morphology and dynamics of morphology changes and function of mitochondria is changing upon this treatment. We will also develop a new 3D culture model using Pickering emulsions, water-water Pickering emulsions, novel clusteroid formation technology developed by Professor Paunov.
1 minute left.
Next, we will explore effectiveness of functionalized nanokinases when novel nanoformulations for our drugs will be also covered with proteases. We will explore this action of this new formulation on our 3D cell platform, and then we are planning to compare this nano delivery, how it compares with the same dose between the drug which is packed in the nanoparticles and drug which is given in the normal form. Expected impact of the project, we think it will help to maintain therapeutic concentrations of the drugs within the 3D tumor tissues. We hope also that the surface coating with proteases will increase the penetration of the drug inside the tumor and potentially achieve the higher effectiveness in solid tumors, lower the therapeutic dose, and potentially improve patients' outcomes in Kazakhstan and worldwide. I would like to thank you, Ministry of Science and Higher Education of the Republic of Kazakhstan, for granting funding for this project. It will be a great pleasure to work on it.
Thank you for a brilliant speech. Thank you. Dear committee, do you have any? Yeah, please, Mr. Kuran.
I would like to ask you, you mentioned some nanoparticles coated with protease. What is the core of these nanoparticles? What kind of material?
Well, that's actually at this very moment I can't disclose this information. Yes, because there may have there will be a potential for drug development and commercialization.
Yeah, I understand it well. Thank you.
Thank you.
Thank you again. One question more.
One more. What's your personal contribution to this project?
I worked on colorectal cancer and other KRAS mutant cancers for the last 2 years with Professor Sarbasov, and actually combined, particularly for this is combining all the people, putting them together and coming up with all this idea myself.
Thank you for your speech. It's very nice, it's very useful for us. And the next speaker is Kristina Rudskaya-Moroshan, is doctoral student from Astana Medical University, Kazakhstan, with the topic Efficacy and Safety Profile of COVID-19 Vaccine in Patients with Autoimmune Rheumatic Diseases.
Thank you very much, and let me to begin. The global community recognizes the importance of vaccination against COVID-19 in patients with autoimmune disease. The data of studies have demonstrated the safety and tolerability of vaccination in this cohort. A significant gap exists in understanding the safety of COVID-19 vaccination in patients with autoimmune diseases. The objectives of our study were to identify the COVID-19 vaccination status in patients with autoimmune disease, assess the breakthrough COVID-19 infection, adverse effects, and flares of underlying rheumatic diseases. The inclusion criteria were outpatients above 18 years of age with confirmed diagnosis of rheumatoid arthritis, systemic lupus erythematosus, ankylosing spondylitis, and systemic sclerosis, and respondents who received at least a single dose of COVID-19 vaccine and completed the full survey. Inclusion criteria And firstly, we had 193 total respondents, and after excluding unvaccinated, we had 62 vaccinated at least a single dose. Statistical analysis, we used a Fisher-Exact test, T-square test for analyzing binary, categorical, and categorical variables, and students test for comparison the quantitative data for independent samples. The results of our study. The most common disease in our cohort was rheumatoid arthritis, following by 22 patients, followed by ankylosing spondylitis, 18 patients. Among 62 vaccinated, all patients received at least one dose of COVID-19 vaccine, of which 36 had 2 and 16 3 doses of vaccine. The most common vaccine received was GAM-COVID-Vax Sputnik V, followed by KazVac vaccine. The table number 2 shows us the distribution of vaccinated patients depending on the therapy of systemic disease. And we registered patient-reported flares in 15 cases. Patient assessed as long-term deterioration after using a vaccine of the systemic disease. None of them need hospitalization within 21 days after vaccination. Any vaccine-related adverse effects were reported in 42 patients. All of them were minor. The commonest was injection site pain, reported by 26 patients. Other minor reported adverse effects are shown in the graph number 5. And only one patient reported about any major vaccine-related adverse effects. It was hypertensive crisis, and none of patients had other major effects such as anaphylaxis, throat closure, or severe rashes.
1 minute left.
Okay, thank you. Post-COVID-19 vaccinated-related adverse effects among patients with self-reported active and inactive disease are presented in table number 3. Statistically significant differences were found in patients with headaches in minimal activity of autoimmune disease. It was registered in 7 cases in remission, but was not identified in moderate and high disease activity. We also find statistically significant differences between adverse events and patient reports about exacerbation of autoimmune disease after vaccination. Among patients without adverse effects, 16 people reported no effect on vaccination on the course of autoimmune disease, and only 24 patients with adverse event denied the effect of vaccination on the course of autoimmune disease. A total of 12 patients were infected with COVID-19 during 180 days after vaccination, of which 8 people received a single dose and 4 were vaccinated completely. Nobody had severe course of the infection with requirement hospitalization, oxygen therapy, or non-invasive or invasive ventilation. In conclusion, we believe that our study makes some contribution to the growing volume of evidence supporting the safety of COVID-19 vaccination in patients with systemic diseases. Our study emphasized that people on immunosuppression therapy tolerate vaccines with no major vaccine-related side effects. Major differences in side effect and breakthrough infection were not detected between vaccine subgroups. It showed a positive safety profile in rheumatology patients, irrespective of self-reported disease activity or received vaccine type. And in conclusion, we believe that realization of region-specific guidelines and studies may assist us in contradiction with the vaccine hesitancy in this cohort and assist in achieving of the vaccination purposes. Regretfully, we have not enough time to demonstrate the comparative data of large studies, and thank you for your attention.
Thank you for the excellent speech. Dear committee, please, Mr. Kuran.
You were so quick that I didn't maybe catch it, but what's your contribution? What was your personal work on this complex study?
Okay, thank you for your question, and our personal contribution consisted of the searching the relevant articles in this term and examination of patients with autoimmune rheumatic diseases after vaccination, making the statistical analysis and forming of the results of our study. Thank you.
Did you publish your study already published?
no, we have not published our study yet. However, this study is a part of my PhD work, which devoted to the study of course and outcomes of the patient of the COVID-19 infection in patients with autoimmune rheumatic diseases.
Will you publish it?
Yet not. However, in future we will publish our results, we believe.
Okay, great. Thank you.
Thank you very much.
Thank you. It's a very great question that we discuss about the COVID-19. It's very important for us. It's a huge contribution from each scientist that we understand the post-COVID period is now. Yeah, we must understand what happened, what we can do with the vaccine, what we can do with the conditions from another diseases like autoimmune, like cancers. It's very important for us. Thank you. Very good job. The next speaker is Parizat Karabayeva, doctoral student, assistant in the Department of Pediatric Disease, Astana Medical University, Kazakhstan, with topic risk assessment of obstructive sleep apnea syndrome and dyspnea in obese children using the Stop Bank questionnaire in Kazakhstan. Please, you have 5 minutes.
Good morning, ladies and gentlemen, our lovely guests. Thank you so much. Today, let me introduce my topic, an evaluation of risk assessment, obstructive sleep apnea in obese children. First of all, let me start from First of all, let me start with problem of obesity. The problem is obesity in children practice. It's one of the medical social problems which is increasing day by day, and especially when it comes to statistics, and nowadays affecting 22 million children worldwide. In many countries, the prevalence of obesity among children has nearly doubled in the last 20 years. And the increase in body weight observed in children of both sexes in all ethnic and socio-economic groups. In Kazakhstan especially, 90.1% of children in the 3rd and the 4th grades have excess body weight, including obesity. Among them, 60.5% of boys and 5.5% of girls have 1st and 2nd degree obesity, while 21% of children have 3rd degree obesity. According to statistics, total children aged 6 to 9 years with excess body weight, including obesity. In female, it's 7.6%, and among them 4.6% it's obesity, and male it's 23%. You can see that in the males it's excess weight, it's more than in females. Excess also it shows in urban area it's a 23, in countryside it's 7.5%. And obesity can maybe affect to mental and the social health, physical health in child, especially it may be affect and the consequences in diseases as cardiovascular system, respiratory system, and in particularly today I would like to talk about obstructive sleep apnea syndrome, which is episodes of the stop breathing while our patient is sleeping, which is syndrome ranges from 10 to 23% in obese child. According to research of obstructive sleep apnea, snoring and the other symptoms of sleep disordered breathing occur 2 or 3 times more frequently in children with obesity. Aim of research was to evaluate the effectiveness of the screening methods for assessing the risk of obstructive sleep apnea in children and dyspnea also. Our materials and methods, we took 30 children with obesity and 31 without non-obese child, and we did anthropometry assessment of BMI and dyspnea scale and the risk developing sleep apnea with stop bank questionnaire and determination of the saturation level in their blood. Here you can see the stop bank questionnaire, which was modified from Russian. Actually, stop bank was developed in 2008 in the American anesthesiologist and modified in 2017 to Russian. This questionnaire, here you can see the all questions. Unfortunately, all questions were translated to Russian and Kazakh. These questions consist from up to 10 years, we asked only parents. From 10 years, we asked our patients. And here you can see the questions as, how often do you have a dyspnea or difficulty of breathing? How often do you have a weakness? Do you have any problems when you're studying? Do you have any problems of difficulty when you're doing exercises?
1 minute left.
Yeah, thank you. Results and discussion. According to our results, 61% of obese children have dyspnea. A direct correlation was found between the degree of dyspnea and the BMI. Children from the 10-4 years have low risk of sleep apnea, which is 73%. Higher risk, it's a 27%, and children from 11 to 16 years, 62% and 38% respectively. The 86% of children have the level of carbon monoxide in the range from the 0.6 ppm, especially when in pulse oximeter they have a blood saturation low than 90. The average numbers, it's a 92, 93. Here you can see our second table. We divided our child into 3 groups. It's from the 6 to 10, 11 to 15, 16 to 18. And here you can see that the high risk of sleep apnea had a child in the 16 to 18 years. In conclusion, I would like to tell every third child with obesity has a higher risk of developing sleep apnea and a higher degree of obesity. Dyspnea is noted in half obese children, more often in boys, and it's a correlation with BMI. When it comes to questionnaire, it's questionnaire affordable and the non-invasive effective screening methods which can be used in the practitioner work as a pediatricians. Also, after questioning this patient, they may go to the screening methods for the otolaryngologist, neurologist, and the endocrinologist. Thank you for your attention.
Thank you for your brilliant speech. Dear committee, we start for your questions. Mr. Professor Pinkhasov.
Great work. In one sentence, if you can elaborate what is the scientific merit of your work, how it will help the society.
Okay, thank you so much for your question. I would like to say that it's just a small part of my scientific work in a PhD program. Basically, this work based from in my work, to be honest, in my work, we are learning the diaphragm in the obese child, how diaphragm can be affected of the consequences of respiratory disease, such as bronchial asthma, hyperresistency of bronchus, and the others. So scientific, it can be maybe using of this questionnaire in our polyclinics. And as you see, that screening methods, it's one of the effective methods than treatment of the child with obesity. Thank you so much for your question.
Thank you. Mr. Kuran, your question.
Great job. But my question is, where did you get or how did you obtain the data on the content of carbon monoxide in blood?
Carbon monoxide. One of my supervisors, Furman Evgeny Grigorovich, he studied about carbon monoxide. I just examined the pulse oximeter of the blood saturation, that's all. And they did carbon monoxide in their laboratories.
Thank you. So we go forward. Thank you very much for your great speech. The next speaker is Gauhar Zhitimkarinova. This clinical pharmacologist from University Medical Center, Kazakhstan, with the topic therapeutic drug monitoring of antibiotics. Please.
Good afternoon, dear colleagues. I'm really glad to present my topic. So, therapy and medicine monitoring of antibiotics. So we define the concentration of the medicine in our blood in order to know that this kind of drug achieved its aim and treated the patients. So what are recommendations? Toxic effect diagnosis of toxic effects, theophylline. So the main medicine which is used with TLMs, so most of them are antibiotics, and unfortunately it is really there is a really hard situation in Kazakhstan with therapy monitoring of
side effects.
Что по 30-40 случаях пациентов при высокой дозе назначения ванкомицина развивается почечная недостаточность, у аминогликозидов также практически такие же процентные соотношения. И к чему это все приводит? Это приводит к развитию резистентности препаратов, резистентности бактерий к антибактериальным препаратам. Здесь представлен пример резистентных форм бактерий, которые выявлены за 2022 год в одной из клиник Казахстана, в UMC. И, как вы видите, огромный процент — это Staphylococcus epidermidis aureus MRCA, где применение ванкомицина практически обязательное. Также немалый процент грамм-отрицательной флоры, где обязательно применение аминогликозидов, таких как амикоцин и гентамицин. Так вот, какие основные лекарственные средства обязательно должны подвергаться ТЛМ? Это ванкомицин, амикоцин и гентамицин. В основном определяются пиковые и минимальные концентрации. В 95% случаев берутся минимальные концентрации. И также есть различные исследования и данные по применению этого метода. В Казахстане на постоянной основе проводится ТЛМ препаратов, таких как иммунодепрессанты, некоторые противоэпилептические средства. По антибиотикам картина более удручающая. Например, это проводится только в Национальном кардиохирургическом центре, в больнице УДП. Необходимо развитие данных методов индивидуализированной медицины в Республике Казахстан, обучение клинических фармакологов и вводить ТЛМ в клинические протокола, над чем мы сейчас и работаем.
У вас 1 минута.
В заключение хотелось бы сказать, что данный метод новый для Казахстана практически, именно в части антибактериальной терапии. Мало какие клиники используют данный метод для своей индивидуализации своей терапии антибиотиками. Конечно, это огромный пул для исследований в Казахстане, и также и у нас планируются исследования по данной тематике в стенах UMC. Спасибо за внимание. Буду рада ответить на вопросы.
Yeah, we have one question from auditory, please. Пожалуйста, можете дать микрофон на первый ряд? Please.
Прекрасная работа.
Спасибо.
Спасибо за презентацию. У меня вопрос. Вы сказали, что вы делаете детерминацию этим антибиотикам. Это в крови или в моче? Первый вопрос. А второй есть, которые спектрофотометрически можно, а есть которые не поддаются немножко спектрофотометрическому анализу, как амицилины, у них нету ароматных колец. Как вы это делаете? Можете объяснить, пожалуйста?
Спасибо за вопрос. Очень актуальный вопрос на самом деле. К сожалению, на данный момент в Республике Казахстан спектр, вы имеете в виду ХПЛС, да? ХПЛС или масс-спектрометрия. К сожалению, по применению антибиотиков, в плане антибиотиков, этого, к сожалению, не проводится. Сейчас единственный вариант проведения ТЛМ в Казахстане – это использование иммуноассей методов для определения концентрации, и определяются концентрации только 3 антибиотиков, как я уже говорила, ванкомицина, амикоцина и гентамицина. Конечно, в дальнейшем мы планируем вводить улучшения в этом плане и планируем проводить и исследования насчет этого, особенно у пациентов с иммуносупрессивными препаратами при взаимодействиях различных и так далее. Так что это большой, как сказать?
Это в крови или в моче?
Простите, второй вопрос, да, это в крови определение концентрации.
Вы определяете в моче остатки антибиотиков, их концентрацию и так далее.
Хотелось бы, это будет большим таким для нас пулом, стартом, точнее, исследований.
Спасибо большое.
Спасибо.
Спасибо за ваш вопрос. Thank you for your question. Dear committee, yeah, please. Пожалуйста, включите микрофон.
Нет, не слышу.
Вот возьмите вот это.
Наблюдали ли осложнения у больных, которые получали сверхдоз антибиотиков?
Конечно, наблюдались. Спасибо за вопрос. Конечно.
Thank you for your question. Of course, we had the complications. That is why we have forced to introduce this method in order to use it rationally, so that antibiotics would be rationally used and there were to prevent the situations of the overdose. For gentamicin, for example, or most of the times are given for those children who are born prematurely. I'm sorry. Thank you so much. We are continuing. Our next speaker.
Tanat Junusova is a general manager from NUR Healthcare, Kazakhstan, with the topic Main Trends in Medical Planning and Design of the Construction of University Hospitals. Please, you have 5 minutes.
Рада приветствовать всех на данном.
I am very glad to see you on this platform. I'm one of the representatives of NUR Healthcare, is the national operator in national healthcare who is regulating the issues on the healthcare under the Ministry of the Healthcare of the Republic of Kazakhstan. What normative legislative acts we are using is on this slide. I would like to note that we had been participating in the amendments, changes, and additions to the normative legislative acts and legislation in Kazakhstan dedicated for the healthcare system, mostly with the beds, in words, that we have been redesigning and advising to redesign. Here you can see construction of the university hospitals in Kazakhstan. Some of them were planned. The construction of the 6 university hospitals in Astana, Almaty, Shymkent, Aktobe, Karaganda, and Semey already had been started. Relevance of our work is the absence of the university hospitals of the international level in the Republic of Kazakhstan, and the relevance of our work is also the higher level of the wearing off of the tiring wear and tear of the hospital facilities and medical organizations, untypical hospitals, and not really suitability of the hospitals of the. Also, there is no possibility to introduce. And also we have another problem. The main trends that we have. The main trends that we have is the health planning, the manufacturing friendly environment, and also the artificial intelligence and robotic techniques, biophile engineer that will allow us to be not only comfortable for, will give comfort not only for patients, also for the visitors, the hospitals that have a space, so special hospitals that will give us opportunity to optimize the heating system. You have only 1 minute. Compact hospitals that health planning will help to So what do I mean by health planning? Health planning is the activity which is directed for the development of the medical projects documentation, which is based on the analysis and the needs of the medical infrastructure of the region, and for people that are living in the registration or other in the region or other administrative territorial unit. We also have standards GCI that we are introducing into our system. Nowadays, it's 10 hospitals that does have GCI models. We also have BIM technology that will help us to manage, let's say, it's the building information model that will help us to manage the hospital activity on a distance. There is also modern scientific educational component that will give us opportunity to have e-learning. Let's say there is a surgery ongoing and in another room, students can look through the can observe the surgery. So this is why we have to think about it whenever we are planning the construction of the medical facilities. And one of the new trends that we are using right now is the smart hospital that will help us for the cleaning, for security. Also rationally, the finances will be also the creation of the smart hospitals will give us opportunity to save costs and avoid excessive costs. So my contribution into this trend is that I am also participating myself while the design was done of the medical facilities. I have also introduced one of the components, which is the GCI, so that in the future hospitals might be accredited as a hospital with, you know, triad that we have science, education, and practice. And this year I've also published that recommended by Kazakhstan on designing and construction of the university hospitals. Thank you so much for your attention. Thank you for your presentation.
One question. You know, it's a really terrible process in Czech Republic to construct a new building. That's why I'm asking you, how much time will it or does it take to prepare such a plan, but project for constructing the new hospital?
Thank you for your question.
We have been developing planning or design. We get the agreement first. We conclude the agreement. Right after that, we do the medical planning, and then designers would plan. Then we would have the sketch project, sketch stage. Well, medical planning would take, depending on an agreement, before 60 days. I would say medical planning exactly would take about 60 days. And we can participate not only for the state managed hospitals, also the also private hospitals.
Можно, да?
how's your planning different from other plannings? Thank you so much for your question. We take into consideration, first of all, we have experience since we have been visiting different countries, we use international experience, and I have 9 years of experience introducing GCI standards in Kazakhstan. We have 10 clinics that I worked with, and they have outpatient and inpatient GCI standards that had been implemented by us. Rational use of the financial aids, taking into consideration our mistakes in the past. And our team is quite experienced. They have been already participating in other projects. Thank you so much for your presentation. As everyone had noticed, we are tackling same problems from different angles, and you are witness that medicine is actually quite multidisciplinary field where you can see different problems could be tackled from different angles and perspectives, and modernization will help us to improve medicine and healthcare system. Thank you so much. I love this session, and session is great. We are about to finish. We have a few speakers. I would like to ask patience and please be active.
Adrakova, assistant in the Department of Eye Diseases, Astana Medical University, Kazakhstan, with the topic Sambo for blind people, obtaining the certificate of the first international sambo classifier for the blind experience in selecting athletes.
Good afternoon, dear participants. So I want to pay your attention to sport discipline, which is called Sambo for visually impaired children. And my name is Adrakova Rosa. So I'm an assistant of visual diseases department. So according to international researchers around the world, so we have about 285 million people with visually impaired visual diseases, and 39 million of them are blind. So sport plays a very essential role in people's lives, not depending from their physical possibilities. So the first one is inclusiveness, the second is physical and psychological well-being, the third one is self-realization and development, the fourth one is enhancing social awareness, and the last one is to maintain friendship. So Sambo Sambo means is self-protection without any tools. And it was created in the end of 20th century. So it includes different techniques, and the most important thing that it is an adaptive kind of sport for blinds, and it is included in FIAS association. This association which combines Sambo sport, and it is one of the organizations which develops Sambo around the world. So there are 97 federations, and 20 of them are on the level of connection. So what are the purpose groups for this kind of sport? So Sambo is a universal kind of different kind of sambos. The first type is sambo, fighting sambo. The second is sport sambo. So it is similar to technical skills, and the third is sambo for visually impaired people. So before that, there was judo kind of sports also for children, for people with visual diseases. So what is the aim? So to enhance the resultiveness of performance, to be included in Paralympic program in by 2028. So Sambo, it's a very effective kind of rehabilitation of disabled people, visual disabled people. So what is the classification of International Paralympic Committee? So here we can include ophthalmology, observation, and method of stabilimetric. According to these criteria, we can investigate stabilometry. So I have an experience in classification of sportsmen, and this picture was taken in May in Moscow. There were too many ophthalmologists from all over the world who participated. In addition, we have championship in Asia and Oceania with the support of FIAS. So we were the first who held this tour among visually impaired people. And I had a very great experience. And I got a certification of Republic and International as an example of a single classificator according to visual diseases. And I hope to make my contribution in the kind of sport as Sambo for visually impaired people. So this kind of sport has importance of inclusiveness, not depending on physical disabilities. Thank you for this motivating speech.
Большое спасибо. Невероятный доклад, и мне кажется, это работа.
Rosa, thank you very much. It's a very impressive work, and you're raising the awareness of society. And I have seen your topic in the program, and so my question is, what are your plans for further perspectives? I think that all the reports were very interesting today, and sport plays so important role because many people lost their hopes when they lost their health abilities. And Sambo for blind, so we have two categories where sportsmen perform with helmets and without helmets. So sport with Sambo with helmet is for fully blind people, and without helmet for partially visually impaired people. And also we have another category when we have where sportsman uses his vestibules. So the effect of sambo is a kind of sport where the effect is so we have different types of sambo, and sambo for blinds includes competition without any fighting. So this is a very young type of sport, especially sambo for blinds. So we just started it in May officially, and that is why we didn't have any investigation work. And as a specialist, I'm just starting my work from the side of ophthalmology, and it will be one of our aims for the future. Thank you. Thank you for your reports, and we are continuing. And I hope that all the participants are satisfied with the answers. Can you return, because we have one more question.
Kind of sport for me, you know. I did 6 years karate in Goju school, and that's why I'm asking. I was injured very often. Are there any injuries in this kind of sport, or does it happen? Are there any injuries?
Can you repeat the question, please?
Okay, so are there any injuries in the sports? Injuries, hurt.
Травмы.
Травмы, да? Насколько опасно это или что? Насколько опасно?
Broken legs or hands. Accidents.
Так как это входит.
As it is one of the sport, yes, there are sometimes injuries, and as in any kind of sport, we have competitions under supervision of doctors, and injuries are not excluded. And I have participated such trainings, and do you know, it was very impressive. And I cannot say that this kind of sportsmen, they are disabled people. They feel tacts, and so they have very good hearing, and they feel the distance of his opponents and the angle, and they can control fully their body, and it is unbelievable impressiveness. So can you imagine how beautiful they can fight? Unfortunately, I have a video, but it is not allowed to turn it on, but I can talk about it after the session. So we have
Bekniyazova is a residency student from Department of Internal Medicine from Astana Medical University, Kazakhstan, with the topic systematic review of the effectiveness of mesenchymal stem cells in the treatment of systemic scleroderma. Very interesting. У вас 5 минут.
Қайырлы күн, құрметті қонақтар. Тема нашего доклада — систематический обзор эффективности мезенхимальных стволовых клеток в терапии системной склеродермии. Актуальность заболеваемость. Первичная заболеваемость системной склеродермии от 4 до 126 случаев на 1 миллион населения. Заболевание чаще диагностируется в среднем возрасте и болеют чаще женщины, чем мужчин. Так, что такое системная склерозермия? Это аутоиммунные заболевания соединительной ткани, которые клинические признаки обусловлены вазоспецифическими реакциями по типу феномена Рейно. Это ведет к распространению нарушений микроциркуляции, фиброз кожи, а это ведет к развитию необратимых диктует необходимость поиска новых терапевтических подходов. Так, мезенхимальные стволовые клетки или МСК. В последние десятилетия активно изучались альтернативные методы лечения системной склеродермии, устойчивых к стандартной иммуносупрессивной.
So for the last decades, alternative methods of treatment of SSD were learned actively, and the consistence of standard immunosuppressive therapy. And the interest which was taken from the data of MSK, which are immunomodulated treatments, which are possible to differentiate. So materials and methods. So this selection was on the platforms of PubMed and Google Scholar on the next strategies: systemic sclerosis plus mesenchymal stem cells. So all the articles were analyzed and we were presented in open access until the 1st of December 2022. So what is the evaluation of effectiveness of MSK? So it was based on active index of system sclerodermy and Rondon methods. In addition, so diffusion abilities of lungs and the level of disability of stomach, visual scale, and Raynaud syndrome, as well as laboratory indicators and immune indicators. So what were the results of investigation? During the period from 2000 till 2022, 92 articles were found. 7 of them were selected, and making analysis from 117 patients which were transplanted MSK, which were taken from different biological researches. And the average age of patients were about 42 years old. And what outcomes do we have? According to this analysis, we have MSK transplantation at SSD and consistent and standard immunosuppressive therapy. Thank you for your attention. I think it was very interesting for everybody.
Ваш личный вклад в это исследование?
What is your contribution? What is your contribution in this investigation? What is your investigation in this research? What is your contribution in this research?
Получается, мезенхимальные стволовые клетки подробно о этом.
У меня есть вопрос, можно?
Do you use antibodies? And do you use combined the therapy? Yes, we have, but we don't have any antibodies, and I haven't worked yet. I haven't investigated SKRG. Antibodies SKRG.
Очень хорошее дополнение, я думаю.
I think that is very good addition to your research.
Do you mean autologous mesenchymal stem cell transplantation? Is it autologous? You know what I mean?
Autologичный есть.
Yeah.
Yes.
And can you say some words on the best protocol that you defined from your review? Do you have, this is one-time transplantation? Are there repeated transplantations? You know, did you understand?
Можно перевод?
Какие протокола вы определили, в которых как раз-таки определялась эффективность применения?
So as you have systematic review and you have very truthful information, so what clinical, what materials did you use? So do you have tendency for only one usage or to? I didn't understand the question. Thank you for your report.
Is Vasu Sharma. It's a student of Astana Medical University, Kazakhstan, with the topic, the future of medicine as we know it. Please. The time limit is the same, 5 minutes.
Good morning, everyone. The future of medicine as we know it. From history to now, the first recorded surgery was performed 8,500 years ago in 6500 BC France, where a hole was drilled into a man who was believed to have an epileptic seizure. Compare that to now, where we're able to perform surgeries in a matter of 1.5 centimeters of hole, and we're able to completely do that surgery, known as laparoscopic surgeries. Introduction. With increasing lifespan and longer lifespans, preventative medicine has helped humanity to cure people of diseases. Throughout human history, medicine has predicted to cure mankind of all diseases, leading to immortality and appearance of new physical and psychophysiological properties in human beings. Let's take the example of lifespan. In 1900s, the average lifespan was about 28.5 to 32 years. Compare that to today, which is 73 to 75 years. So in only a matter of 100 years, we've been able to double the lifespan of humans. So the recent study that was performed, where experts were tested using Delphi method and were asked to identify 3 main drivers in the future. The first driver is going to be well-being, second one was data info for personalization, and driver 3 was climate change. Well-being. Well-being is defined as a combination of prosperity and activity satisfaction with life, happiness, and opportunity to develop one's potential. In fact, well-being in the recent studies was given even more importance compared to the absence or presence of disease. The way we tackle well-being is using a value-based healthcare system, which focuses not only on the disease, but the outcome of the patient as a whole. Many companies recently have started becoming more interested in giving a holistic approach to the patient rather than just focusing on the health outcomes. Smart delivery. Smart delivery of drugs and active substances has helped us reach millions of people in remote locations which are not available, near the hospital. Smart delivery of biologically active substances has potential to be widely used in climate change, in climate medicine, and targeted cancer treatment. Wearable devices. Wearable devices such as bracelets, rings, and insulin adapters can help us give not only observation of data, but also implementation of treatment. Telemedicine. Telemedicine comprises a remote technology and helps us bring the brightest minds of medicine to the most remote locations. The integration of technology in healthcare will likely to continue and allow patients to access medical services remotely and enabling continuous monitoring of chronic conditions. I personally had the opportunity to work in a London-based startup company that uses AI and artificial intelligence and big data to analyze a lot of patients and give automated responses to patients and helps us improve communication between doctors and patients. gene editing, CRISPR, or clustered regularly interspaced short palindromics repeats uses Cas9 gene editing technology, which can be ideally used in the future to not only predict diseases such as chronic cancers, but also cure them almost instantly. Currently, the use of Cas9 protein is restricted because of bioterrorism, but in the future, this might be the case. Smart hospitals. Smart hospitals are going to be an ecosystem that uses big data and integration of technology to use and improve medical sciences. Predictions of experts in the future. So these are the predictions. Conclusion. Obviously, there's a lot of positives in medicine, but there are going to be some negatives, such as conservatism. Modern technologies allow healthcare to be improvised, but people don't want anything near them. People don't want governments and multilateral organizations should partner up and across public and private sectors and take social responsibility in allowing innovation and scientific progress in healthcare. This can lead to improved lifespans and a better well-being. Thank you very much.
Thank you for this brilliant speech, dear colleagues. Do you have any question for speaker?
No, go ahead.
Yes, please.
Thank you very much for this presentation.
You're
what is the research question in your presentation, and what is your personal contribution on it?
Well, currently I haven't published anything, so I'm going to publish a review article which will comprise of all the information that has been put inside this. So basically we used a Delphi method. Delphi method is a form of discussion in which we use multiple scientists and ask various questions to doctors and people in the healthcare industry and see them and ask them about the key drivers and help them identify important factors that can predict the future of medicine. Thank you.
Please, one question.
Thank you for the talk.
Yes, sir.
What about the nutrition part of successfulness of the Delphi? How it's important? I mean, you mentioned so many parameters, but what about nutrition?
Nutrition?
Yes.
Yeah, obviously I mentioned about climate change, for example. Climate change was identified as the most important factor, but it will manifest in the next 50 years. So nutrition is going to affect, particularly due to climate change. There will be ineffective cropping, and new methods will need to be developed. For example, we are developing more methods like artificial food, for example, fruits, proteins, which are using gene editing, and other methods to artificially develop crops. And climate change, as they mentioned, climate change is going to affect nutrition in a larger span of population. Yeah. Thank you very much.
I think that just to give you some remark, nutrigenomics.
Yeah.
This is another field of medicine which mainly correspond to the preventive medicine. And we may prevent and even cure many diseases by adjusting proper nutrition.
Yes, sir.
Okay. And one question from me, please define future.
Okay, that's future. Something that we look forward to.
50 years.
Okay, in medicine, yeah?
Yes, we are talking about medicine.
Yeah, of course, yeah. So if you have seen my slide, in the second last slide, I predicted they have given the next 5 years, 10 years, 20 years, and 50 years. So in 15 years, the experts have predicted that artificial intelligence is going to completely take over all the administrative work. For example, information of the patient, history taking of the patient, and the doctors will only assist the artificial intelligence and computer programming. Apart from that, when we talk about genetics, genetics will be so much well developed that it will completely be able to predict chronic diseases and identify specific genes that are responsible for causing chronic diseases. And hopefully with the use of CRISPR and Cas9 protein, we'll be able to edit it out.
Thank you for your question. If no one mind, I want to continue the question from Israel colleagues about the nutrition. And also, we know that it's very important direction in medicine is the treatment medicine, right?
Yes.
But also we have the preventive medicine. What about the preventive medicine? Is it some places, for example, for this type of medicine in the future? What do you mean about?
Exactly. That's what I was trying to point out. Preventative medicine is going to be even more well developed in the future. For example, recently we in the COVID-19 pandemic, for example, a proper hygiene, a bedside routine, washing your hands, and all these things have proven to be very effective in the prevention of diseases. But also in the future, we will integrate things like genetics. And we will integrate things like predispositions, for example. People have predispositions to diabetes and cholesterol, for example. So we will be able to identify people or groups of population that are even more predisposed to certain diseases, and will preventively, cure them of these diseases, and even before it happens.
Thank you. Thank you for your answer and for your speech.
Thank you. Thank you.
So we go to the next speaker, please. It's a final speaker at this session. Torgun Sanak is a student of Astana Medical University, Kazakhstan, with the topic, How Kazakhstan Struggles Gender Inequality in the Modern World. Please, you have 5 minutes.
Good morning, dear students and professors and dear guests. I'm glad to present there right in front of you. I'm a third-year student of Astana Medical University, and the topic that I'm going to raise is quite relevant and a large scale. So I will try to fit in the time limit, 5 minutes. Women make up the 50% of the world's population, which equal to the half of human potential that thanks to which economy, politics, and other aspects could develop. And the existence of gender inequality in our time is huge injustice and the biggest problem in the field of human rights, said UN General Secretary. And in 2015, the UN adopted 15 Sustainable Development Goals, marking the 5th goal is gender equality. This is a brief review of the gender policy of Kazakhstan. In 1998, ratified the key conventions of Beijing Declaration, such as the Convention of the Elimination of All Forms of Discrimination Against Women. In 2003, first gender policy concept was approved. In 2006, was created strategy for gender equality of the Republic of Kazakhstan 2006 and 2016. In 2009, adopted the law, two laws, law on set guarantee equal rights for opportunities for men and women, and law of prevention domestic violence. In 2016, they created concept family and gender policy, Republic of Kazakhstan until 2030. I used the method SWOT analysis to analyze the strengths and weakness and identify our strengths and use them, capitalize to opportunity, achieve the goal, minimal risk from the threats. In June 2020, UNDP in Kazakhstan received silver certificate of gender equality mark. In the annual UN Human Development Report in 2021-22 on the Gender Development Index, Kazakhstan, it was included the first group countries with a very high level equality achievement on Human Development Index between the men and women. And Kazakhstan moved up 15 positions thanks to successful gender development reforms and ranked 65th out of 146 countries in the 2022 from the Global Gender Gap Index. And this, we got the 29th place in terms of economic activity and opportunity, 27th place in the education, 44th place in health care and survival. And the weakness. According to this criterion, equal access to political rights opportunities, the country is 103rd place out of 146 countries. The law introduced a mandatory quota, 30% for women and yes, electoral party list as well distribution deputy mandates. And but if quota divided by criteria, only 9% of women are actively involved in political activeness. In Kazakhstan, share the women business owners is 45%, but however, this is a particular in small and medium-sized businesses. And discrimination in employment and difference in wages between men and women. The average salary of women in Kazakhstan is for 21.7% lower than men's salary. This is the statistics of politically active women and men in Kazakhstan. The opportunities, women entrepreneurship development centers have been opened in all regions and country. One of the main developer of Kazvak, Dr. Biological Sciences, was Professor Consul Zakaria. This is the fourth vaccine that created approval from the World Health Organization. Therefore, half of scientific staff in Kazakhstan are women. The list of professions was restrict of work. Women has eliminated the legislative level. There are 31 family report centers in the region. And the threats. The Criminalization of Domestic Violence repealed the Domestic Violence Prevention Bill 2020, increasing the number of crisis centers, single mothers and victim violence. According to the Minister of Internal Affairs in the Republic of Kazakhstan 2021, 400 women die annually at the hands of their partner, husbands, due to domestic violence. The concept of family and gender policy remains the question. And by the statistics, every 6 women have been victim of sexual abuse. In conclusion, gender equality is a serious issue that requires attention and action. Only ensures equality and respect the rights and freedoms of all people, regardless of gender, will lead to the creation of a more just and harmonious society in which each individual can realize the full potential. During the years of independence, Kazakhstan has taken a number of progressive measures in fields combating gender inequalities. Despite this, the problem is inequality is still relevant and requires further effective work. Thank you for your attention.
Thank you for this. Very grateful. Please, one question from the auditory.
Okay, so first of all, it's definitely one of the most important issues in my point of view. Okay, thank you for raising it here. It takes a lot of attention in Israel as well. I have 2 questions. The first one, as far as I understand, you showed data, general data. Do you have any data regarding gender equality in academia in Kazakhstan? This is the first one, okay? And the second one, are you familiar with some strategies or actions to improve gender equality in general and specifically in the academia?
Thank you for your questions. The first question, I'm sorry that I'm sorry. I don't have specific academic information, statistics. I'm sorry, but next time I will improve my report with the specific.
Question, I ask if you have, in general, this information is available. Somebody collect this data. Do you have any position anywhere in Kazakhstan that collect data regarding gender equality in the academia?
Yes, we got. Yes, we got a lot of source of information. There are UN reports, UN in Kazakhstan, UN Women, and every year, every 5 years, if I guess right, we got statistics that that Prime Minister gives us. I'm sorry. And the second question, can you repeat?
Yeah, the second one, are you familiar with any kind of strategy or actions that are going to take place in order to improve this?
Yes, as I got mentioned, there is...
Specifically the academia. Yeah, I saw your slide. I'm asking
and
about...
the concept of family and gender policies in the Republic of Kazakhstan until 2030. Our government plans to give a lot more attention for politics, because we have very very minimum women that politically active in academia. Sorry, I don't know.
Thank you. Any question?
Do you want me to speak in Russian or in English? What will be more
Russian, please.
Russian, please? Okay, so...
So first of all, thank you so much for your presentation. It's very interesting. It's very important topic that you're raising. And I think that in perspective, we have a very big room actually for the capacity building, for identifying this topic. And with this summit, we also will have very good platform in order to publish. I think in Israel, colleagues, you will find good colleagues who will be able to, will be glad to publish with you. I'm international certified volunteer of LPR and from UNFA. I'm one of the trainer of volunteers, and since school I have been very active and I'm an advocate.
Я просто хочу сказать great respect.
I would just like to say that I great respect.
Dear colleagues, it's our final stage of this summit. So we had a very productive seminar. So I'm glad to thank our commission that it's very important for us to discuss a lot of topics in scientific area, in which direction, in or different direction. So this is not the end. We will continue our discussion in the coffee break session. So I think that from the Israel, from some organization from Kazakhstan, we can find any collaborative researches, maybe some ideas which can we develop together. So thank you very much for each participants of this summit. Thank you. Goodbye.
Уважаемые коллеги, на следующую сессию в 11:50 собираемся. Сейчас кофе-брейк.
Раз.
Один, два, три. Раз, два, три. Один, два, три. Раз, два, три. Раз, два, три. Три. Раз. Раз, два, три, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6, 7, 8, 9, 10. Раз, два, три. Чего интересно эти? Раз, два, три, 4, 5, 6, 7, 8, 9, 10. Раз, два, три. 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6. Просто раз, два, три, 4, 5, 6, 7, 8, 9, 10. Раз, два, три. Раз, два, три, 4, 5, 6, 7. Так лучше. Раз, два, три. Раз, два, три. Раз, два, три. 4, 5, 6, 7, 8, 9, 10. Раз, два, три. 4, 5, 6, 7, 8, 9, 10. Раз, два, три. Раз, два, три. 4, 5, 6, 7, 8, 9, 10. Раз, два, три. Нету. 4, 5, 6, 7, 8, 9, 10. Раз, два, три. И раз, два, три, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6, 7. Поговори ты.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Раз, два, три. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Раз, два, три.
Но они вот так все говорят.
Раз, два, три, 4, 5, 6,
1,
7,
2, 3. Ну, это главное,
8,
чтобы не
9,
заводилось
10.
на это.
Раз, два, три. Раз, два, три. Меня нормально вот так слышишь? Раз, два,
Да,
три.
да, я хорошо тебя слышу. Это вот сам себя
4, 5,
обычно
6,
плохо
7,
слышишь.
8, 9,
Потому что у тебя
10.
звук и здесь звучит, в ушах от этого. И еще оттуда доходит. У тебя складывается звук, когда ты говоришь. А когда кто-то другой говорит, ты уже понимаешь, что это. Давай вот здесь микрофончик заменим, а? 1, 2, 3. Ага, ништяк. Ну, хоть это не... Хоть удобно им. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6, 7, 8, 9, 10. А? Какой пульт? Не надо, не надо. Нормально все. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Раз, два, три. 1, 2, 3.
Раз, два, три, 4, 5, 6, 7, 8,
а
9,
что
10.
это? Мы в зале есть?
Раз, два, три. Раз.
В зале мы есть, я не пойму.
Должно.
Hey! Такое ощущение, что только в этих мониторах. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6, 7.
Эй. Раз, два, три. И 1, 2, 3. Раз, два. Раз, два, три, 4, 5, 6, 7, 8, 9, 10.
1, 2, 3, 4, 5.
Раз, два, три, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 5, 5, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6, 7, 8, 9, 10. Раз, два, три и 4, 5, 6, 7, 8, 9, 10.
Раз, два, три, 4, 5, 6. О, сейчас намного ярче.
Сейчас выключу на секунду.
Да, я выключу. О.
Эй. Эй. Раз, два, три, 4, 5, 6, 7, 8, 9, 10. Так, эй. 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 Раз, два, три, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 5, 6. Поговори со своего.
1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 8, 9, 10. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7.
Раз, два, три, 4, 5, 6, 7.
1, 2, 3.
Раз, два, три, 4, 5, 6, 7.
Ну, слабо, конечно.
8, 9, 10.
Но по умолчанию они все так будут работать, эти микрофоны.
Раз, два, три, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6, 7, 8. Так. Раз, два, три, 4, 5, 6, 7, 8, 9, 10, 10, 10, 10. Раз, два, три, 4, 5, 6, 7, 8, 9, 10. Раз, два, три. Раз, два, три, 4, 5, 6, 7, 8, 8, 8, 9, 10. Раз, два, три, 4, 5, 6. Раз, два, три, 4, 5, 6, 7, 8, 9, 9, 9, 9, 9, 9, 9, 10. Раз, два, три, 4, 5, 6, 7, 8, 9, 9, 10. Раз, два, три, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 3, 4, 5, 6, 7, 8, 9, 10. Так, раз, два. Раз, два, три, 4, 5, 6, 7, 8. Раз, два, три, 4, 5, 6, 7, 8, 9, 10.
Один, два, три, четыре, пять, шесть, семь. Один, два, три. Один, два, три, четыре, пять, шесть, семь, 8, 9, 10. Раз, два, три, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6, 7. 1. Нормально? Раз, раз, раз. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3.
2, 3.
Вы также будете здесь?
4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6, 7, 8, 9, 10. Раз, два, три, 4, 5, 6, 7, 8, 9, 10.
Один, два, три, четыре, пять, шесть, семь. 1, 2, 3.
Recording in progress.
Уважаемые коллеги, занимаем места. Мы сейчас уже начинаем нашу...
Dear colleagues, take your seats. We are going to start our session.
Надя. You are here.
Hello. How are you doing? Very good. Hello. Okay.
Dear, we are continue the work of our summit, and the next session is connected to if startup projects. Коллеги, начинаем нашу очередную сессию. Pitch-сессия медтех стартап-проектов молодых.
Project of young scientists. All participants are here, and let's start. And firstly,
we would like to give a first floor of welcome speech to Abdulda Atamuratovich Shamenov, chairman of the board, Joint Stock Company, Fund of Science, Kazakhstan. This is the organization that supports all of the startups and does bring closer startup initiatives and scientists to the business sector.
Hello, everybody. Welcome to our summit.
We are very glad to be in this international summit. This is an honor for us to be here, and I'm so glad that in the frame of our summit, of this international summit, we have separate pitch session, medical, technical, startup projects of young scientists. As a decree of President of the Republic of Kazakhstan had been pointed out that we need to make separate efforts in order to commercialize, monetize the science projects, and we will need the policy. And the concept of the Ministry of Education and Science had been designed in order to provide grant finances. So all of those stages of commercialization, monetizing, when business was interacting with scientists or this kind of projects, was risky before, but nowadays government is assuring the safety here. The Fund of Science is not limited with the financial aid. We also support different projects. We have different measures where we invite international experts, speakers, so that we would have common understanding how exactly we can commercialize our scientific discoveries. In order to meet the business sector with science, we always conduct this kind of events. Recently in summer, we had conducted together with Ariel University the Impulse in MedTech. That was the name of the workshop or conference. We have already announced the grants and scholarships and financial aid contest. I would like to invite all of you to show your potential and show potential of your projects. We also see here the members of the Club of Business. Here it'll be very interesting to hear potentially interesting projects that we probably will invest. And despite giving this kind of support, we also promote projects and we open the doors to the sectors of different sectors. We also conduct the PR of different projects. We have portfolio of projects since 2018, and we see that volume of sales is more than 30 million tenge. If we will look at the construction in Kazakhstan and looking at the taxes that had been paid, we see that the amount is more than 50 billion tenge, more than 50 billion tenge. So we see the results of our work that we conduct. I would like to ask all of you to be active, and I would like to express my gratitude to all of the international partners, associations, the organizers of this event. It is good that we have this kind of event where we can show our potential, so that in wonderful day we will have a product that will improve lives of not only Kazakhstani people but also people in the world, and that will be opportunity for us to go for export. Thank you. Thank you so much, Elnar Atamuratovich. We would like to start our work of session, and the first floor we would like to give to Master of Medical Science of Medical University in Semey, Omarbekov Edel Dulatovich, who will share a light to his project, which is forecasting infectious diseases with application of neuron nets on the example of COVID-19. Participants of a summit, I would like to greet you on my behalf and present a project that will allow to forecast infectious diseases and apply neuron nets. First of all, if we will be able to use medical data, and it will give us opportunity to gather medical data that will subsequently give us opportunity to use best practices in order to forecast the infectious disease. In Kazakhstan, we don't have this kind of analogical system for forecasting and preventing infectious diseases on the basis of the artificial intelligence, but we also have separate initiatives that are partially would overlap. And there is a system, active system of epidemiological monitoring infectious diseases that is coordinated by the Ministry of Healthcare. It includes the collection of data from medical organizations and laboratories. There is also work is conducted in implementation of digital technologies in healthcare, including the systems of electronic medical cards and telemedicine. It will create a basis for collecting and analyzing big data. Right now, we don't have complex solution that would integrate all of those components. That is why our project would significantly improve the system of forecasting and prophylactics of infectious diseases in Kazakhstan. This is relevant task that would also demand consolidation of the efforts of government, science and medical community. So what problems do we have and what solutions do we have? The problems is that we don't have effective methods for forecasting of spreading, how exactly the one infection might spread, and which limits the ability to timely react and respond on epidemics. Second, significant financial costs and resources are needed in order to fight with infectious diseases. Third one, there are also complications with the collecting and analyzing medical data. There's also no systemic coordination between the bodies and countries and states that would have clear identification of a problem and what exactly, which would worsen the efficiency of the measures taken by us. And social panic and disinformation would also impact on the perception of people, and it will also support chaos during the epidemic. So that is why we think that our solution, is that we should have exact methods of forecasting how exactly infectious diseases are spread, and we need to base all of this on world experience. To be exact, we should have the exact data, who is doing what. At the same time, we should integrate algorithms of machine learning that will also, but in its turn, it will give give opportunity and provide with timely response on epidemic. And if we will talk about the end consumers, is the medical organizations, it's government bodies and organizations of healthcare, it's the scientific research and educational organizations, patients, and industrial and technological companies. Potential volume of the market, it's the TAM, for example. So TAM, let's say our product is oriented on adult population of Kazakhstan, which is 11 million people. Even if small share of it, let's say 1%, will be using this product, and the cost will be, and the price will be 1,000 tenge, then we understand that our profit will be, revenue will be 110 million tenge per month. For medical organizations, let's say Kazakhstan has 4,000 medical organizations and our product is oriented on all of them. So each organization will pay 12,000 tenge, which is 4,000 organizations multiplied by 12,000 tenge per month is 48 million per month. SAM, it's the available volume of the market in Kazakhstan. So for the physical persons, ordinary persons, taking into consideration the factors that with the access to internet, with the habitual usage, the SAM might include 10% of the population, which is 1,100,000,000 tenge per month. For medical organizations, it's the revenue will be 9,600,000 tenge per month. Regarding the business model, so one of the ways of monetization for the persons, for example, subscription by persons, the price will be 1,000 tenge. There will be additional services that could also give opportunity to increase our revenue. For government facilities and organizations, it will be 12,000 tenge for the subscription if you represent government organization. There might be also packages offered, which are special packages with the offers for government clients. Second channel is for both the private sector as well as the government sector. As you can see on a website, first year we see the revenue from persons, from population is 50 million tenge, from government bodies 20 million tenge, so overall it was 70 million tenge. The self-cost is 15 million tenge, so the profit, the pure net profit will be 55 million tenge. It's only for the first year. Second year, 85 million. Third year, 115 million tenge. And so on and so on. Thank you for your attention. If you have any questions, please don't hesitate to ask. Idil Dulatovich, thank you so much. Colleagues, do you have any questions?
Yes.
Thank you so much for this interesting presentation. My two questions are, what is the stage of the development of the project right now? And what are the main challenges that you face when you need to gather all the data and consolidate it?
Thank you so much for your question. Well, of course, there are issues on data collecting. Why? Because some of the data is officially, it is not given, so we don't have access. We need to apply official requests. All of them are stored in Republican server or database, which is the database belong to Ministry of Healthcare. Regarding the stage, our project is on a stage. We have the model of the forecasting, but we are lacking in data right now. We have already designed the algorithms of all of the measures for medical workers and patients. So what shall be done in this situation, for example? Thank you.
Thank you.
I ask another question. Good afternoon, dear colleagues. I would like to ask you, these informational system will be working separately or integrated with other information systems? And what do you envisage for the personal data security? Thank you so much for your question. Right now, the data that we have are encrypted. It doesn't contain surnames. There is no confidential information like the place of living or address of living or telephone number, only the diagnosis, and that's all. So, and the date when he was admitted, he or she was admitted. So based on this data, we decided to run a forecast, or for example, when will be the drop and increase, let's say. Of course, integration is important because in order to collect data, if it will be integrated into existing system, it'll be good. Good afternoon. I would like to ask a question. So what are you trying to say? What are you trying to create? Will that be a mobile app? How exactly it will work? So a person who would like to get services will just type in all the information. Thank you so much for your question. We have a questionnaire that shall be filled out by patient. And if patient has signs of, most of the times it's temperature, right? It means that there is an infectious beginning, so they will fill out this questionnaire, and based on this questionnaire we start forecasting. So a person is admitted to the hospital, hospitalized, gets treatment, it might be outpatient treatment, so we can collect those data as well by means of questionnaire. If person has a temperature, he will receive algorithm of steps to do so. He shall be isolated. He shall not go to clinic with temperature. He shall call a doctor to home. It's just simple algorithm, let's say, that was in effect during the COVID-19. Right now, for example, it's the season for flu. And we could run around the questionnaire and give them fill out and give the algorithm. We will also pay attention to also have another infection that is running now, so we need to integrate this. Colleagues, it's not only the conquest, so we have Siberian plague right now running, so we need to do something. Well, we have young scientists. As you can see, the delivery is very important. So it's my feedback. You don't have to include everything into presentation. Within brief time, audience didn't have opportunity to look at the presentation that you had. So just remember, presentation that you have, it should be just supporting you. Could you please raise your hand if you're going to pay for this application? You see? You see? It's 20%. Not all of us understood what to pay for, what's the uniqueness of this startup. So that's the problem right now. What is the problem? What is the ways of solution? So if you do the profit market fit, you need to show it right away. So colleague asked regarding the stages. On which stage is the project? Have you done the experiments? Is there any feedback from potential clients? This is the concept idea. Is that a prototype, or it's the application that people are already paying for? So you need to show this result so that you could show how mature your project is. Thank you so much, Abdullah Hajimuratovich. Indeed, this session has a role of educating and training to give opportunity to young students, have critical feedback, how exactly they should present their feedback and what to do next, etc. The next topic will be delivered by assistant of the Department of Eye Diseases from Medical University, Astana, Rosa Kurmangazivna Adrakova. Visual diseases, reproduction, manufacturing of glasses, oko had been done with 3D printing.
Чтобы куда-то попасть, нужно бежать как минимум
to get some places, you need to run twice fast. It was said Alice in Wonderful World, and as it was said, so you need to develop along with time. So invisible problem. So the World Organization of Healthcare. So 28.8% of population wear glasses and have visual diseases, and they use glasses. During the pandemic, this number has increased.
Short-handed people increased.
And short-handed people increased, and there are factors which are bad ecological factors, and usually pensioners and retired people and customers are among these people.
The problem is not only the frame. When we talk about the prices for the frames or for the spectacles, it's not only the frame of the spectacles. We also need to think about diagnostics of having the lenses, and that is why we thought, since spectacles are so expensive, what to do with it. In order to do that, we decided to develop this kind of program. So from idea to the actions, we had procured the 3D printer, and we decided to print first spectacle frames. Spectacle frame. Thank you so much for your applause. Why 3D? Because the availability of the technologies is needed. It's the high time to use best practices and high technologies. That is why we have frames for the spectacles that is accessible. At the same time, it can endure all the breaks, and it'll be used for a long time. What had been done today? I am the winner of the Eco Lab 2.0. It's the contest for the young scientists, and I received the grant for the 3D printer, and I have authoring certificates, and we have procured the 3D printer that you can see on the screen, and 3D printing will ensure the durability, cost cutting, and individualization. And with in our department, we decided to develop the models of this project, develop this project together with students. What is necessary nowadays? First of all, we need a facility for the printing. We will also need 3D threads, which is done by recycled plastic bottles. We also need to work on financial model. I'm also the winner of contest for developing financial model. Asad Janusova, it's the business trainer and business mentor. She's very famous. She's helping out young scientists, developers, or startuppers to develop the financial model. We're working with her in order to develop our financial model. What else we will need? We need 2 patents, and we need to register our trademark. So in conclusion, first of all, we have contributed into the environment, safety of the environment. We are recycling the waste, and that is how we minimizing our carbon emission. I would like to also play my video regarding the manufacturing the spectacle frames. How do they look like? There is no volume, I see. There is no voice filament. It's the 3D thread with these stages. This is how we manufacture. I have prototypes. I can actually talk about it. The first model had a very low level of quality. We've gone through several stages. This model that you can see in my hands. And now we came to one of the last models. It looks like this. This is the quality. I can try it on so that you could look on me. Thank you so much for your attention. Rosa Kromagazina, colleagues, who has question? I have a small question. This is a very relevant topic. I understand that you use plastic, which is the waste, right? Not all plastic is suitable for it. That is correct. Let me finish my question first. Well, so not all plastic could be used and melted. Where do you get the raw or the waste materials? Do you have a laboratory which would prepare these raw materials from the waste in order to produce your products? Thank you so much for your question. It's quite relevant question, and it's asked a lot. First prototype during the project being done by Business Lab, which is the ecological project as well. We have collaborated. We have collaboration with engineer. I'm sorry, and with filament. First model being tried on the thread produced by this engineer that I have mentioned. It's very, very soft. So that is why we're on the stage of improving. How do you do that? We're trying different materials. We mix them, combine them, and then see what we get. And right now, it's just a prototype we're trying out right now, to be honest. That's the first stages of our manufacturing. I hope that we will get our recipe of our thread that we can use. Thank you so much for your presentation. We see that it is prepared project. There's an understanding of a product, understanding of the market, ESG trends also important, and I can see those ESG trends reflected in your presentation and project. Individual design, which is the tailored spectacle frame, which means that we can actually, so any client can actually tailor own design of the frames. But I have a question. A good idea, you're in early stages, 10 guys, for example, are also interested in this, with this project. How do you protect it as a copyright? What did you think about patents, and so that others wouldn't steal your idea? First stage was the copyright certificate when we have just started our project December last year. Half a year passed. The next stage, we would like to prepare the 3D thread that we would patent and register, and the trademark. Awesome project. You need to make a branding, just branding. You need to brand. Can I turn on presentation on the first slide? Whenever we hear the name, oh, okay, that was the name. So this is my design that I've been designing myself. It's the Eco Oko. I have another question. Not all plastic is compatible with skin, so it'll be good. That's the first question, actually, as ophthalmologist I was interested in. So that is why we work with Ecological Association of Kazakhstan. This is the subject, actually, for studying.
Спасибо большое.
Thank you so much, Rosa Kurmangazieva. This project has a future. Can I please add a couple?
I mean, I'm not familiar with ophthalmology, but do you see any future for ecological glasses? You know, the glass itself, not the plastic.
Maybe.
Okay. So.
I will think. Okay. Thank you.
I want to first compliment you for the short and focused presentation, which is to the point, and I think that we all were able to understand exactly what you're saying quickly and in good demonstration. Video always helps, and that's great. Have you considered the other phases of the preparation? One is the frame, but then you have the lenses and you have the measurement and all the stuff. Is this process shorten the time of preparing glasses or actually lengthening the time? Because in the ophthalmologist shop, you have prepared lenses. So you do the test, and then you fit the lenses, and you have it ready. When you need to 3D print it, does it makes it longer?
I couldn't understand the question, to be honest, if somebody could understand. So we're talking about process of the, let's say, production of the glass. If we go to the ophthalmologist cabinet, we just go there, the frame is ready, the lenses are ready, and that's it. Well, right, yeah, I understood what you mean. Well, I have targeted audience, which is retired people. We understood that people who just use it for watching TV or for reading, you will not need designer glasses, let's say. So that is why I decided to have a target audience. I have decreased a number of people with presbyopia, which is the age people. So if you have +1, for example, we would give you the frame, which is ecological friendly or environmental friendly. You will say, yes, I will protect environment, so that is why I would like to buy. So we will have ready-made frames as well, not only designers' frames. Thank you so much. The next speaker with the project is the team. They will talk together, Ariel Kazakhan and Zarina Qadralina. These are our students of Medical University Astana. Socially significant project. That is based on Kazakhstani product Gent. Cannot change the slide. We are presenting UNM, which is the ecologically pure product with the improved recipe of Gent. Malnutrition is bringing to mortality of 60% of people because of the malnutrition.
So in 2019, the number of diabetes diseases were about 50,000 people, and 86% were dead with COVID diagnosis. And traditional dish of our nation is talkan. So people with targeted audience were people with obesity. And on the basis of Medical University, together with professors, we investigated the nutrition of this product. This is wheat product. In this collection, there were interesting facts about Kazakhstan history, and we have prediction, and we are working on cultural sphere, and it influences in a good way on our health and protect from atherosclerosis. So
It's also very good for the digestive system, as well as it will prevent the oncological diseases. This is mostly the targeted audience would be people with allergies or with disorders of the digestive system. We have started working with the workshop on the production of the food. We also provided with work mothers, single mothers, or with kids, single mothers. We also won national contest in Inactus, and we also we ended up second in Inactus Fall Business World Contest. We have done a huge path. We walked through the huge path, and analysis shows that in the full capacity, the revenue will be $756 million tenge. The SAM will be 4,500,000 tenge, and SOM is 690 tenge. We have done also analysis of our competitives. Gent in our desserts is very difficult to measure the quality. That is why we think that Gent is very friendly for digestive system, as well as it doesn't contain sugar as much as other desserts. So that is why that will be one of the benefits of our project. And we think that in perspectives, we also will be collaborating with pharmacists. Of course, all of the costs will be manufacturing and administrative ones. 2022, once we have received the grant, we had started our process in Astana, where we could receive opportunities to rent the workshop, investments in the amount of $15,000 for renting the workshop and equipment. Most of the employees are the students of Medical University. CEO is the Ariel Kazakhstan that you see right next to me. Benazir Mamatova is the CEO. CFO, it's me, Zarina Kadralinova. Thank you so much. I have a quick comment. I would like to note the contribution of Enactus. It's awesome project. You had considered the working places, the jobs, you're opening new places. It's like Bill Gates, who had found his company when he was school. But don't think that I'm encouraging you to drop out of school. Stay in school, kids. But everything starts from students' year, so you need to think about that. You need to remember that too. At the same time, maybe you will be thinking about increasing the potential. I understand that your focus is the national food, but at the same time, you can expand your project up to the lifestyle trend, which is healthy lifestyle. You could show, for example, the benefits of this product, and you can... Now you have a patent for the useful model, useful product. There is also instrument PCT. Whenever you will cover all of the markets, all colleagues who are coming all over the world, for example, they can come over to Kazakhstan, taste it and like it, and they would like to have it in their countries. Then you can think about potentially going for export. So I'm just drawing attention on international potential and protection of copyright and intellectual property. I have a question. First of all, I'd like to say that your project is opening the giving a job to single mothers. So that's one of the benefits for the society. I would like to understand what is the raw material? You use wet? It's the oatmeal. Is that whole wheat? It's the oat flour. And then you use oil, right? So what about cholesterol? Cholesterol can actually increase. We understand that the level of the blood, the level of the sugar in the blood will decrease, but the cholesterol might increase. So you need to think about, because your patent says that it's useful product. Maybe it won't be very national if you use different crops. Yes, we've already thought about it, that the cholesterol will increase. Well, but there is also be a Paul additive, and it will actually decrease cholesterol in the blood due to its spectrum of the merit, which means you don't want to change your national dish, right? No. Taste is taste, I understand. Yes, taste is important. Colleagues, I would like to draw your attention. Whenever you were asking question, for those who are going to go to demonstration, you have to have some products with you. You could have give us your product and we could taste it, try it, and then it will actually dissolve all of the doubts. So maybe you will think about that as well, like before it was done with the spectacle frames. Zarina? I'm sorry. Yes, there is a question from audience. First of all, well done. In the world, there are many protocols, and the quantity will be only increasing and increasing continuously. The power of understanding what is going on in the world, the power is in understanding what's going on in the world. Something, for example, might be good for someone, but for others it won't be that good. So maybe it'll be good if you could think about creating database so that you could understand what is going on right now. It's descriptive study. It'll help. When you say that it could help to many people, you know, there are many things that will help to many people. So if you will have database, you can track the population that will find it useful for their health. There's a direction which is nutrigenomics. I would offer you to think about this because we have published actually the paper that shows the connection between inflammation, stress resistance, and microbiome of different diseases. And your technology, how exactly your technology, for example, would influence on these factors that I have mentioned, then you will be competitive. And maybe you will only win if you will have experts of artificial intelligence and dietology. I see that you will go further. I think you're very serious, ladies, and you will go further. Think about what will happen in 10 years. Well done again. Thank you. Thank you so much for a comment. I would like to add a couple of words. If to be brief, it'll be great if you could use evidence-based medicine in order to support your idea. I know that you have, let's say, not patients, but consumers. So I would like to wish you good luck. It'll be interesting to talk about those cases. Zarina, Arista, thank you so much. We're pressed in time. I think all of you will take into consideration the feedback is given. It's only for improvement of your project. Thank you. Colleagues, our next project will be presented by Жанара Adelbekova. amu.kz, application for sexual education, sex education.
Good afternoon, dear guests and participants. I am Adelbekova Jantar, and I'm a doctoral resident. And today I would like to present my project on sexual upbringing of girls. This application is called amu.kz, and it is translated as elder sister from Kazakh language. And we would like that each girl will find support here. And this is the information is in two languages, in Russian and in English. So where did we find this idea? We need to understand that teenagers are future adults, and this topic is like a taboo, and we can face some issues such as early sexual
activity, and we can see facts here. Because of ignorance, and because many of them think that it is clear, and in addition, I want to say about infections, sexual transmitted diseases. It can lead to many complications, and it will depend on the demography of our country. And we came to conclusion creating a special application on our targeted audience, and our task is to make informative modules which is aimed on raising awareness on sexual social activity, and to prevent negative consequences. For today, I have created an interface of this application, and we will make corrections in the future. And I included this in my slides in order to make it clear. So gamification can look strange, but you will have some subdivisions how it works in separate ways. So on the third picture, you can see on the calendar of periods, and on the fourth picture you can see AI application, and you have here two types of doctor, psychologist, and so many girls don't know exactly when and where to go to specialists, and these doctors can help you to differentiate the first reasons of your depression. So what are the results of startups for today? So I have created TikTok accounts, and now I have more than 29 followers, and each of these videos have 1 million sites, and through this site I try to prevent the negative consequences, and I try to explain how our organism works during periods, and what to do in periods. So the potential volume of market, and here we have data only in Kazakhstan. So we have 19 million population in Kazakhstan, and 9,500 are women among them. And the third table shows the amount of teenagers. And also I have made comparative table with analogs, and here we have such applications as RU and Intimatics, and from all these applications, Intimatic is in Russian language. You can see this comparison on the screen, but I want to say that in many of these criteria we have priorities. This application will be in two languages, I want to remind, in Russian and in English. And our business model you can see on this screen, and I want to stop on income from advertisements, from content, and additional function, so selling separate modules and commissions from advertisement, sponsorship, and grants. So here you can see our team. Adilbekova Jainara, it's me, Azamat Jumanov, project manager, and Khalida Sharipova, she is our mentor, and she is our docent. Thank you for attention. And also we want to find potential
Thank you for your attention. Do you have any comments, colleagues? I don't want to comment on the whole, but you can see science-based projects, and you have and also we have presentation projects with the support of applications. So science volumed projects. So we have budget. We have Danyar Bektienov and up to 100 million tenge they can investigate in mobile applications. And it is you can get acquainted with them, and you have an opportunity to get financial support. I'm Danyar, and I'm from Kaz Innovation Company. And I would recommend you to take a part in our grant program. Unfortunately, we finished our support this year, but we invest in such startups. And if you have methods and gamification, and it had been worked out, and if you just need to show the commercial, and you need to count your outcomes, and in pitching you can perform, and it is possible that you would be a winner. And this year about 270 participants, but we try to choose the best of the best, and I have seen your presentation. You are well prepared, but you don't have any numbers. So what amount of budget do you need? But we will consider financial information. Briefly, that's all. So you are welcome. We have Instagram, Telegram, and next year you can apply to our program. Sorry, I want to ask a question. So to make application, it is really expensive, and to supporting applications is also expensive. So do you have any prototype version of websites for learning this sphere that you would like to include your consumers? Thank you for the question. So the first idea I had when I opened my TikTok channel, and I have noticed the result that girls are not don't have any awareness on this topic, and I need clear database. So I have this clear database that it is just, but I don't have, unfortunately, separate site. And on the level of concept, I think that we will move forward in this sphere. I would like to give a comment. So I'm an expert and consultant, and I would like to start that Janara, when she raised this question that there are many questions in TikTok about sexual upbringing. So the main aim was to give correct answers to these girls. So we don't have any economical facts, and it is not possible to make a startup without these data. In each presentation, I'm trying to find scientific part. And when you said that you have about 30,000 followers, and you have the strongest base for scientific researchers, for sociologists, for psychologists, and I want to tell to my colleagues, to the dean, if it is possible to make accurate platforms for your audience. All the scientific world will join you, and you will have best articles in this sphere. But don't forget, please, to send me via WhatsApp this information. And follow your channel, and you will know everything what is happening. It is really useful product, and I am like an urologist. I can, with all my experience, I can say that the level of pregnancy loss is a real problem in our city, and we need to develop. And the level of awareness among men is also increasing. It's about 50%, and we need to tackle this problem. Thank you very much for your performance.
I'm not familiar with the Kazakh practice on the web and on the digital media, but I think that almost 30,000 followers and 1 million views is an enormous number. And when you started talking, I said, well, is this project going to get attention from the public? And the answer is absolutely yes. So I don't know what you've done, but how did you manage to get so many followers? This is very impressive.
Thank you so much. Можно будет на русском, да, ответить? Да, я как-то нахожу время, мне это все нравится.
Yes, I have time to find my followers, and I really like it, and I want to be useful for society and to give my knowledge. And I have finished 7 years of medical education. I think that I have opportunity to give my to show that in Kazakhstan we have good medicine, and we can trust our doctors, and we can show our competence, and will be useful for society. Thank you.
We've seen so many good startups that failed because they weren't able to communicate the message to the audience, to the public.
Я приведу. Столько много стартапов были безуспешные, потому что...
So many startups failed because it was very difficult to message to the audience. It was a problem. Yes, we have this idea to improve medical startups via my channel in order people have opportunity to know about it. My name is Azamat, and I'm the representative of scientific committee, and also I'm a project manager, and I want to give addition to the question which asked this previous girl. We want to work on design and project context, and we can see that we have high demands, and that is why so we had a very good analysis of markets. Adilbekovna, thank you very much. Very valuable comments, and now we have 2 projects ahead. And the next project, a student of University Astana, representative of student committee, developing a smart application. And thank you very much for for invitation. So our team chose this phrase. So the aim and the task of our project is to make a mobile application on the basis, technology is on the basis on dynamic control of indicators and health, such as chronic health, such as diabetes, arterial hypertension, asthma, and chronic renal diseases, which led people to control by themselves the level of compensation of their diseases and increasing number of doctor visiting. So we have problems and solutions, and problems are lack of control on health condition, a decreasing number of effectiveness of treatment, the decreasing lifespan, and worsen of its quality, absenteeism and presenteeism, and loss of quality of employment of population, social and economic damage. So it would lead to social and economical damage. And our solution is so that our mobile application will lead to have electronic diary of all notices and indicators of people's health. And this application will let not only to hold the dynamic history of all indicators in a good format of tables, but also with all individuals anthropometric indicators of patients. It will prevent of decompensation or decreasing effective treatment and recommend to visit a doctor. On this slide, you can see the description of our product, and this is the main menu of our application. So the potential volume of our market is 5 or 10% of population, and more than 20% have disease of diabetes. So we have analyzed the market, and we came to a conclusion that we have our competitors, and one of our advantage on our market is Kazakh language in interface and the smart diary. The application where you can find all the information of your diseases, and opportunity of visualization. And our business model is B2C, 7 days of access that you can try from the moment of registration, and after that it will have 930 tenge per month. It is equal to $2, and the main channel of selling trades platforms, App Store and Play Market. And we have additional business models, B2B and B2G. And the total amount of this project is 60 million tenge. And about 43% of this project will be given to advertisement sphere. And our comment and contact. So Jumanov Azamat Anuarula, so he is the author of this idea. Omar Aziza Mukataeva, so she is a manager, and Kairgilde Oralbaevich, he's a professor and the main expert. So this is a mobile application about medical interaction, and it has many functions which can let clients to check and to evaluate the difference between taken medicine and medicine that they should have. And we have different trade names. And you have a potential 367 potential integrated medicals. And it is not possible to remember for doctors all the names of these medicine. And we are trying to have integration in with all medical systems to cooperate with medical centers and hospitals and to have results. So this data will lead not only to avoid all the negative consequences, but also it will lead to have the spectrum of databases of doctors' mistakes, what pharmaceutical groups they know less than others, and in this means our two projects and our further projects will join in one, and we called it like a digital ecosystem of healthcare of Kazakhstan, and it will let to work this application together and to form like a domestic doctor which can help patients to live with their diseases or with more quality and longer. Thank you for your attention. Thank you very briefly, and also you had time to tell about the second project.
I believe that this is a very important project, especially for countries where there are huge territories and distant patients, so the remote is key. Is a project like that will be subsidized or purchased by the government, or it will eventually have to be private and paid out of pocket from patients? Because I believe there is a critical difference between the two.
Yep, we for the first.
Can I answer in Russian for this project, drug data? So we were planning that we can have. So we can work and we can earn with the of governments, and our smart diary indicators, we want to receive a budget from patients because our team doesn't see any collaboration with governments, and so we want to do it commercial oriented, and also we can consider the grant annual grants or financial support on our so to make this application free for residents of Kazakhstan, and everything that is necessary is to have an ID card and IIN number, and for post-Soviet Union population, and for and to make this application not free for all other citizens.
If I made two tips. So the first one is when you have a project that you are planning to use to the huge market, the out-of-pocket payment from patients is a big challenge. To get the budget to develop is one thing, but then you need to substantiate the business model. And if you are aiming to substantiate it from patient out-of-pocket payment, it might be a challenge. So if you can collaborate with the government and kind of make it part of the integrated in the system, that would be ideal. And the second point, which is relevant for all the startups, and it was not mentioned here by anyone, and I trust that everyone is doing that, but due to lack of time, you don't mention that, is the competition. If you're planning to develop this project internationally, keep in mind that there are many competitor startups that are doing exactly the same. So I would encourage you to think about, to know the landscape, the competitive landscape first, and secondly, to identify areas where you believe you bring added value beyond what is already available on the market. Otherwise, the chances to succeed internationally goes lower. But very impressive. Thank you.
Thank you very much. I appreciate your comments. Thank you. And advices.
I would like to ask, according to this application, so will you have recommendations about avoiding of abnormal reactions in order to prevent abnormal reactions? And I do not give the details in pharmacology, but we have some actions which are restricted, and we have medicine that we can give recommendations to go to the doctor, and the doctor can give solutions. So is it dangerous to take these medicines by themselves? But we don't have any clear recommendations. But even from legal point of view, we cannot do these recommendations. But we have subdivision in this. It is called prescription checker. So the patient can fill in all his parameters, chronic diseases, weight, height, and all other details. And to fill in all the medical drugs that he is taking at that moment. And our application can give the result with the chronic liver disorders. And it can give the answer that you need to go to doctor. But so we are aimed to work with our clients and to raise their awareness, but we don't need to interact in the relationships between doctor and the client. As a perception of this project, so I can say that this project has international potential, and how we receive this project. And so some commissions, they are considering about 20, 30 or 40 projects. And as you cite Alisa in Wonderful World, so it was said that we need to be as fast as we can. So when all the partners, so the first who applied, he first came, first served, as we can say, and we can and we should be actively prepared for this project, and we call you to be actively prepared. Azamat Anuarovich, thank you very much, and we are running out of time. And the next project is for Imangali Daurinole. The project Health AI, and the aim is to make the quality of service better. Good afternoon. My name is Aslanbek Kurmangali, and I'm the student of the second grade. I want to present you my project Health IE. So this is startup, and the aim is to develop the quality, and our aim is to make medical digital platform which is aimed on raising awareness of population, and our task is to make the unique format of selection of databases to test our work, release, and to go on digital market. So long queues in long queues in hospitals, incorrect choosing of specialists, self-treatment, and non-traditional medicine. The solution is artificial intelligence. Statistics of people who suffer from diabetes, and so it is raising each year. And we came to a conclusion that the population is not aware and have many mistakes. We have made analysis of the market, and the total number of population is 19,899,377 people. And adult population is 11,580 people. So we have conducted competitive analysis. So we have Kazakh language, which is accessible. We have online storage, accessibility, accuracy, and our business model is, in order to make it easier to work with the final customer, is B2C. Our partners are investors, doctors, and IT specialists. The uniqueness of our application, that NeuroNet gives so we have subscriptions, resources, etc. So our team is scientific organization manager, Imadgali, Adilkhan, and Jandos. These are our contacts. Thank you for your attention. So which comments do you have? Do you have any questions? No questions. I want to say briefly and exactly. Accurate and brief. Today we considered many perspective projects, and thank you for your participants. Thank you for your to Adil. So that despite of your busy schedule, so you were with us till the end. Thanks to Kamarjan Talgatovich that today from the student level, so you are trying to develop initiatives. From initiatives to products, that we have grant budgets, and as you can see that members of business partners club have participated today, and maybe you will tell us a little bit about yourself. So you're like MedTech accelerator, and we, many thanks to international partners. We see your great experience that you bring.
I believe there is huge potential for that, and Science Fund is open to support these kind of collaborations, that tomorrow Kazakhstani products would be able to commercialize on various international markets. Thank you.
Let's do it.
I want to express my gratitude to all the participants of our today's panel session, and I want to say that in the nearest future, so we will create a hub in our medical university that will work 24/7, and we will consider all the ideas, and I want to express my gratitude to our friends from Israel. And we have plans to create a joint hub with Israel, and we will implement it together. And we're going to finish our panel session, but we are not going to finish our work in these directions. And that is why I call all the students to be active. So state States is ready to help in all the startups and our colleagues. And so my mission and my task as a rector is to create all the conditions in order to transfer complicated language to clear language for you, in order to create different projects. They can be different, starting from mobile applications to complete to creating artificial intelligence. So we are with you, and everything it depends on your actions. And knowing foreign language, it is really important, and I call you to develop and in this sphere. I want to pay attention that Medical University of Astana is being financed on some projects, and where we have one project, we have 10 projects. And the director of the department you can change contacts with him. So we will be glad to see your participants in such a huge projects. Colleagues, and for today our session is finished. Thank you very much for your participations, and let's meet in 20 past 4. Past 2.
14 past.
Here.
Sell down.
вот аға микрофоныңызды қосып мынаға беріңізші.
Қайырын алды?
Мына жерден бір екі.
Жоқ, ол первый батарея есть. Вот эти возьмите. 35-й.
Еще один человек есть, да?
Не сізбен сөйлесем.
Вот я и думаю. Звук.
Right. Good afternoon, everyone. And my name is Miatelli. I'm the Vice President for Medicine at Astana University. And I will facilitate the panel discussion today, this afternoon. Very important topic on the formation of the medical pharmaceutical clusters in Kazakhstan. Is an important initiative under the aegis of the Ministry of Health of the Republic of Kazakhstan, and with the SK Pharmaceuticals and Astana Medical University and Ariel University are the strong partners and the intellectual hub for the development of the cluster in Astana. The cluster is trying to foster collaboration, partnership between industry, the government, the academia, the private sector, and is a good model really to create a pharmaceutical industry and to create a vibrant pharmaceutical industry for the Republic of Kazakhstan. We are really fortunate to have some very eminent speakers today, and we have 1 hour and a half. So without wasting any time, I want to invite the first speaker, Nurlan Iskakov. He's the chairman of the Medical and Pharmaceutical Control Committee of the Ministry of Health of the Republic of Kazakhstan, and he will give a report on the role of the medical pharmaceutical cluster in the development of healthcare and the pharmaceutical industry. Thank you.
Добрый день, уважаемые участники саммита.
Good afternoon, dear participants of our summit. I'm really glad to meet you today here in the frame of summit, standing at the Vanguard of Medical Education, Science and Practice. And so I'm really glad that I graduated university here, and that we have such events here. Thanks to management of this university. And I would like to say that experience from pandemic time, and so we don't have enough medical treatment, and so we're taking measures on developing pharmaceutical sphere of our country. Based on data, so briefly.
By the task of the President of the Republic of Kazakhstan, the manufacturing of the drugs and pharmaceutical products shall be increased up to 50%. And we know that since we are dependent on the imported products, we do lack a lot. So volume of investment, that is why we decided to make some investments into pharmaceutical industry. So the volume of investment in the pharmaceutical industry is $29.2 million for 2022. This data was extracted from the website of National Bank of the Republic of Kazakhstan. Volume of pharmaceutical products, it's $920 million for the first half of 2022. The import for the 2022 is 1.7. If I will illustrate the example of top producer regions for 2022, it's Karaganda region, up to 18%, Almaty 27%, others are 11%, which is the localizations and also localization in other regions. Nowadays in Kazakhstan, there's functioning 158 pharmaceutical producers. 42 of them is the drug producers. And 116 is the medical equipment and instruments and tools. And more than 1,000 names of the medical product are medicine out of everything produced. 110 of the manufacturing industries are under the modernization. We have in 18 regions except Kızılar'da region. Other regions are also focusing on manufacturing medical equipment, tools, and drugs. For the effective development of the pharmaceutical industry, we decided to make a benchmark. An analysis of global experience in the development of the pharmaceutical industry includes Germany, Italy, South Korea, China. Whole world is actively involving into the cluster development because everyone understands that in the frame of the limited resources, it's the opportunity for synergy and collaboration. Belarus also is focusing on pharmaceutical cluster development. All of these clusters are created in order to increase efficiency of the joint potential. Since I would like to repeat myself, we have limited resources. So in order to enhance the efficiency as well as the capacity building, we have medical pharmaceutical clusters in order to produce innovative medical drugs or medicine. And those clusters include Astana, Shymkent, Aqtobe, which will which will give the impulse for innovational projects in the pharmaceutical producing industry. Introducing the cooperation, through cooperation, interaction, innovational ideas will be one of the key tools. So what are the purposes, objectives, and areas of activity of the cluster? The activities of the forum clusters concentrate on increasing the competitiveness of product of the domestic pharmaceutical and medical industries, as well as the introduction of innovative technologies through the expansion of cooperative interaction. What tasks do we have? Number one, formation of a single intra-cluster space and strengthening of cooperative interaction. Second, intensification of interaction between the university and scientific production sectors. 3, increase in the number of small and medium-sized innovative companies, active participating companies, it's the startups, spin-off companies, branch companies, etc., etc. 4, attracting smart direct investments. 5, development of innovative infrastructure. 6, providing assistance in creating favorable conditions for promoting the products of participating organizations. And what directions do we have? Number 1, development of production potential or producing potential. Number 2, development of human resources. 3, development of international cooperation. 4, interaction with government bodies and organizations of the Republic of Kazakhstan. In this slide, you can see medical and pharmaceutical clusters for the development of innovative medicine and medical devices. Nowadays, you can see the list of the organizations, LLPs, JCs, joint stock companies that are already working in the cluster. So in the first cluster, medical and pharmaceutical cluster, Astana, we have competence center as Nazarbayev University, research center Nazarbayev University and National Center of Biotechnology, clinical basis, the Corporate Foundation University Medical Center, production center is in Karaganda, help activities, the different workshops and the seminars. In the second cluster, Aqtobe, we have different Aqtobe organizations as well as the universities and medical centers. Aqtobe Regional University will be the research center, for example. The clinical base will be in Medical Center of West Kazakhstan State Medical University and other clinical sites in the region. Production center is the Farm Aqtobe. Held activity is the workshop on November 29, 2022. That's when exactly the measures been decided to taken. And medical and pharmaceutical cluster Shymkent, we also have various, we have the same division for the Competence Center, Research Center, which is the research and development clinical base, production center, and also I have mentioned the health activities. When we talk about, I would like to point out that medical and pharmaceutical cluster Astana will be the impulse for the development and increasing the efficiency of the pharmaceutical production. The result of our activity or these clusters should be the new organizations, also the new drugs that will be introduced into the market. We will also, one of the results also will be the medical devices, equipment that will be assembled as well as manufactured in these clusters. We also will have localization of different international companies. For example, nowadays we're planning to localize or open the branch of the South Korean organization. Aqtobe Medical Cluster will be responsible for the west part of Kazakhstan and will be the center of the it'll be the center that will be it will be the driver of the whole West Kazakhstan. I think that we are right now working on the provisions as well as good communicated system that will mitigate all the risks that could be occurring in the manufacturing of the pharmaceutical goods. It will also allow us to have medicine that will be affordable for everyone. That is why we would like to, nowadays we would like to invite all of you, students, researchers, in order to maybe realize your ideas, implement all of your maybe startups. This will be the platform that will by means of synergy will be just growing. Maybe among of you there are people who didn't even think about this and didn't think about your direction for the future development. We're open for cooperation. For all of the clusters that will be created overall, I would like to talk about the R&D centers. It's one of the nuclears of any cluster. So nowadays it is good that we have three components. First is the policy from Ministry of the Healthcare, because everyone understands that we need exact policy in order to develop the direction. The huge work is conducted by the ministry and government overall for attracting the big farms. Not all understand why do we need these kind of big companies. People think that why do we need big players? We have our own players. But we need to understand that big farms are coming with their own technology and management policies. These companies will hire our people, local experts, local researchers, and we will be exchanging on these platforms our ideas, knowledges, and skills. They will introduce their own standards on our platforms and in our country, which will increase the level of the quality of products overall in the local market. This will be the chain. Of course, all of the chains like laboratories, all of the medical universities, medical facilities, all of the medical organizations, all of them will increase their quality. And that is how is done transfer of technologies. Those technologies that are best technologies, best practices, and are acknowledged in the world as sophisticated will be introduced in Kazakhstan. So that is why I think that it is good that we are discussing these kind of topics in the walls of the university. especially medical university. We also said that there will be support of the research works on the basis of the R&D centers. The technological equipment of the laboratories also will be supported with the big players in the sector, and the patents also will be supported. So on the level of the big farm, we will be trying, on the level of the R&D center, we are trying to pool, increase, and improve all of the things that will be helpful for generally for development. And here, if you look at the diagram in the middle circle on the left, you can see all of the R&D centers. Then on the second circle, you can see all of the measures that will be needed, and those are the measures that will guarantee the provision. For example, it's the tax privileges, customs preferences, simplified procedures for foreign workers, and the procedures of the registration will be also simplified for those companies. Also, the new structure, which is the farm cluster, we call it farm cluster, also will be something new introduced in Kazakhstan. We have working groups right now. We have a council, coordination council that is promoting our work. We would like to also create a separate council that will be monitoring all of the development works. We need to review the whole infrastructure, maybe some of the financial aid, or there are a number of events and measures that shall be taken. From the point of business sector, it should be done on the level of the private sector as well as the national level. We have representatives of all of these industries and sectors here. So if we will collaborate, I think we need to talk and try to produce, let's say, roadmap. With Nazarbayev University, we already discussed some of the issues, but I think that we should gather together, all of us, and try to talk what kind of roadmap all of us are having in the vision. If we will talk about the human capital, it's not a secret. We're experiencing deficiency in staffing, in human resources. It's both in the private sector as well as the government sector. Those who are working in the pharmaceuticals, for example, there are few. So that is why we are experiencing deficiency, and mostly suffering are the ones who are producing pharmaceutical products. So that is why we need to review and try to identify what to do with it. So we need to understand from a longer term perspective what specialists on the level of the technology, medicine, biology we will need. I think that it's a separate question that we need to discuss and consider. We can create anything, but we won't have people who will be working there. We're also planning to design a detailed roadmap. We also considering all of the best practices in the world. So if we will talk about necessary measures for organizing cluster activities, the first thing will be it's development of a roadmap for cluster activities. The second one would be determining the personnel for each cluster that will be needed, developing a program for their provision and for obtaining and for retraining. And if you remember, during the pandemic times, we were heavily dependent on import. So that is why If you remember, we had a huge problem with replacement of the import. So that is why I would like to say that we are forecasting that up to 50% we will try to replace imported products. So in conclusion, I would like to say that for preventing some of the preventing diseases, we have to have this kind of production, and which will also contribute into the life expectancy. Thank you.
Thank you very much. Now I would like to invite Yerkat Iskaliev. He's the chairman of the board of SK Pharmacy. He's really the individual who actually initiated this this program more than a year ago, and he's going to tell us about the unified distributor of the Republic of Kazakhstan, the SK Pharmacy, the wave of development of the pharmaceutical industry. Yerkat.
Спасибо большое. Хотел поблагодарить.
Thank you so much. I would like to express my gratitude for invitation. We're good partners with this university today. I think that the most strong ones powered through, and the best specialists are here, I guess. So I will be dedicating my speech to you. Kazakhstan is a country which is trying to be competitive in the pharmaceutical market, and what activities, some activities are going well, some not. That's what I will talk about. A little bit of statistics, I think Nurlan already shared, previous speaker already shed a light on some of the statistics. 54% is the retail segment and 66% is the budget-funded one. If we talk about budget segment, it means that it is procured by government. I think Kazakhstan is one of the... I think Kazakhstan is among few countries that heavily supported by government. Through the years of 13 years, within 13 years, you can look at the diagram and see the growth. And for example, Uzbekistan and Russian Federation and Tajikistan also actually took SK Formation as the example. I would like to say that I'm very honored to be example for those countries, and I'm quite proud of it. We have signed 98 long-term contracts with big players in our market. I would like to say, could you raise a hand who was in Kazakhstani manufacturing facilities? I would like to give you a promise. I'll make a list. Let's make a list of the plants that you would like to visit. And I will assure you I will make it happen. Why I think that people should visit? Because this is how you can upbring patriots. I think that it is important to know where the drugs or any kind of medicine or any medical devices had been produced. It should be the same thing like you treat your clothes. This is a good slide that shows everything that we produce. It's quite cheap, I would say, affordable. I think 13 years ago it was breakthrough once. But the most important thing that we are giving an impulse to those pharmaceutical companies to go further and think in a broader perspective. If you remember, in Moscow, there was a giant company where thousands and thousands of people were working there, from 23 to 27-year-old people are working there. I was there, I was visiting. I think Kazakhstan would like to be in a scientific positions, but we need to also acknowledge our level. I see you, I see your manager of this university. He is highly interested in cooperation, so that is why I would like to invite all of you to join us in this path and journey. I would like to also show you map of domestic brands of the pharmaceuticals. We have a lot of Turkish brands, but there's an issue, I think, some injection drugs. The trend was tablets. Before, we work with South Korea now, and Germany and China, and I see that there's a trend on injectable drugs. I'm not a pharmaceutical person, I'm not a medical worker, I'm a professional logist. I deal with logistics only, more than 15 years. I'm one of the developer of the Silk Road project. And I think that I'm showing you logistics now. I think logistics should be a stimul, should be an impulse for the partnership. And it had found its reflection in the decree of the President of the Republic of Kazakhstan. And I think what should happen on this region, we need to create hubs and big storages in order to distribute to the nearest regions. We think that Kazakhstan, from the point of view of logistics, has the best opportunities and possibilities for that. I think we can do that. We've been already working on the idea that production, the best production always has best logistics, which means it has storages, is the idea which is laying behind this project. We have been working on issues. I have been writing an article. You can find it in Facebook. My name is Yerkhaliyev Yerkhat. You can find it in Facebook. We know that the font is capricious. The market is one of the difficult ones. So that is why we had created favorable conditions for all of the contracts, for concluding the contract, for signing. We are openly competing with neighboring republics. We're competing for the market with other countries. These are the countries are very famous. It's the India, it's the China, and if you have a good proposals, devil's in a detail. So maybe some of you will come up with a bright idea. So please, we are open for discussion. You can come over to us. We know that our president is scrupulously controlling and monitoring medical and pharmaceutical sectors. We are also operators for the for procurement of different equipment. We are also the operators for localization of some innovative drugs, medical devices, medical equipment. We also involved in clinical trials. I see Israel here, who is very strong in this field. I think science shall not be separate from production, and more important, from the real world. We think that here, students who, I think I see, there might be students who actually will make a breakthrough and lead Kazakhstan toward those goals that I'm talking about. Most of the times in Kazakhstan, it happens that some of the things are not working jointly together or doesn't see the overlapping, let's say, spaces. So that is why I think that science shall be supported all the time. Regarding the production, I would like to say that we didn't reinvented the wheel. We just we just produce whatever others are producing. The most important part was to have domestic production. And you know that generics are produced in every single country, so that is why we shall forget about thinking of exporting generic drugs. We know that each country produces it, so that is why we have to think about innovation. Only with innovation we can go for export. Regarding normative and legislative acts, we need to create favorable conditions that no other country has if we're competing with someone. First of all, we need to create kind of favorable conditions. So that is why we have been working with different associations. I'm actually personally ready to listen to your propositions from students, from workers. Regarding the big farm, what I would like to say, we are quite successful, maybe not in that level that we desire to be. And we have a project with Big Pharma, which are the giants in the production. Nowadays, we are preparing for the visit to United States of America to localize some of the big pharmaceutical company brands in Kazakhstan, and South Korea, for example, had started from it. If we will name them, it's Pfizer. Roche, for example, we're also working together with Nazarbayev University, where we are strategical partners in Nazarbayev University. We're localizing 3 products. Roche is also going on, is developing screening programs in Kazakhstan. We would like our university to be cooperating with Roche. AstraZeneca, for example, also 5 types of original medicine will be localized in our market. We would like to have clinical trials to be done in Kazakhstan. Why Kazakhstan is not oriented on innovational positions? Second person in Bayer had explained to me, I agree with that, because clinical trials are weak in Kazakhstan, which means that we see innovational medicine or drugs only when they're registered. If we would have clinical trials, then our people would be better in it. Novo Nordics, they're top it's the top organization in the diabetes. We don't have it in Kazakhstan, so that is why I would like to ask management to create centers of obesity. It's a global problem in Kazakhstan as well. And diabetes is the disease of 21st century, so that is why we're ready to organize the center. I think we have the potential, and maybe we will have clinical trial. And Nordics, we're trying to work with them and talk to them and try to convince them to localize their products here. Regarding the medical equipment,
so last year we started centralizing of medical equipment, but not only centralizing, but also making exporting countries, and to implement our own production, and it will give. So we have one farm, we are planning to make a farm cluster in Aktobe, so we have a big factory there, and I have visited China recently. I have visited Midria factory, and we have, there is a robotic manufacturer, Korean and Chinese factories, and as you know, Samsung company is translating to Kazakh language, and I think all these companies, including GNA and Philips, so they are watching the market much faster than small companies. And medical equipment is the sector where we can get the result up to 50%. And the question which is being discussed, and I have my own position, that one of the problem of the development is not clear understanding and vision in the country, so the state support. So we have a center, but I can see that there is a low staff potential because people even do not understand that it is beneficial and interesting, and they can receive rewards. We have lack of storage and document turnover. According to the last situations, we need to catch situation as 1 year has passed. And also we conducted together with Big Farm the model of effective medicine, and I want to share this as a scientific word and or for discussion on your round tables. So I have the next position that in KPI of medicine, so we have reducing of mortality in the increasing lifespan expectancy. And before giving the recipes, so medical equipment should give screening to the doctor in order to be evaluated, and the doctor shall have a good level in order to read these images and to have effectiveness as a result. So it is restricted for such companies as a big farm with these companies. So as you know, in Korea, so 24 screenings are 24 screenings can be experienced by a person when the human is in its difficult position. So it is really difficult to treat him. And we have information. It is called investment guidebook. Maybe you can invest somebody in Kazakhstan. So we have this guidebook on our site, and we can send this presentation. And we would like to invite you on our forum. And so we are. So we have such forums as MedTech. So it is. So we are doing this forum for the third time. Here you can see the context, and we are ready to receive you for training and practice. So we are cooperating with your management and managers, and we are ready for cooperation and to. So Big Farm is a wish and would like, and it is also a necessity to cooperate according to our agreement. And maybe, so as we say, one of the scientists created
Excellent overview. I suggest that we will take some question at the end. Then now I'd like to invite Gary Gellerman, the Dean of the Faculty of Natural Sciences, Ariel University, who is going to tell us about the strategy of modern drug discovery from lab to clinics. Gary.
Спасибо большое коллегам за приглашение.
Thank you very much for your invitations, that you gave me this opportunity to present my presentation, and I want to do it in Russian and in English. And I see so many young students who are disciplined. In order them to feel themselves comfortable, I think that it will be a good So mainly I would speak in Russian, but if I don't manage to do this, I will speak English. Today I'm going to tell about the strategy of modern drug discovery, how to create medicines. So I would like to show what is. So in my lab there are about 15 PhD students, and I am working tightly with my classmates. And so we are good with lightning technology. Except lightning technology, we have you can have these publications. I have other publications which are connected with modern drug discovery. So we're talking about targeted drug discovery. So for today, it is a modern branch for making medicines, and everything is in the aim of cancer and do not touch healthy organs and all other parts. So what is according visualization? So we can give something, but we cannot see anything. We can know anything only if we if the client claims about his pain. So when we're talking about infrastructural and neural images, so it gives very good results. Don't be afraid. It's a chimero, so it's a ancient Greece, so what is drug chimerism? So, for example, you have two medicines which can be in one treatment, but toxic is really high. You have two kind of drugs. We can take one of this medicine and the second, and we can mix it. But so only from one medicine, so the effectiveness becoming higher. Blood-brain barrier, it is phospholipidous membranes which do not allow to get to the brain. In order to treat brain cancer, you need to go through all these membranes, and it is really difficult to do this. So we need to find effective ways or medicines in order to do it correctly, in order to go through these membranes, and we are working on it. So so 15 people are working on this. So not only antibodies but also peptides are mainly, and antibodies, they have advantages. So why do you have peptides? So this connection between antibody, we have triple more in this in its quantity, and they're more effective. So to find new kinds of treatments, it's really trendy, I would say, for today. What about patent toxins? So we need to attach something to these antibodies. So it is considered as a toxins which are really toxic, and they are from the group which are on the market today. And if you look at this, so you can understand that we cannot receive the Nobel Award here because we don't have basic invention, and so we are thinking about how to improve it. I would like to show you an example.
maybe 2, 3, or 10, or 100 times. So is it okay for you?
In Russian. So firstly, I want to so we have two examples here. So I'm gonna fight. So it is not a medicine, so it's a candidate which always fail in its clinical investigations because of the toxic. So it's a 2 inhibitor which is responsible for unwinding of DNA. So it should be regrouped before attaching, and after that we have apoptosis and the cell dies. So the second one is temozamide. So it is going through all these membranes, and this pink group. So unfortunately I don't have any marker, but I will try to explain. So it also kills the cancer cells. So we have two mechanisms and they are working differently. So we were thinking that we can join all of them. You can see that we matched black with pink and pink with green, and we see that it is better than its combination. Beside this, amu.kz, so it is in different doses. So we have small dose and big dose. But if you give it in a small dose, so it would not be effective. After administration of this amu.kz, so you receive the first medicine. It goes into DNA. It is near that place where DNA is separated, and it works much better. So we're doing this experiment on mice because students do not agree. And the minimum, we do this experience only with mice, because they are human immune system. They can receive this cancer timbre. So 3 and 5 milligram for 1 kilo. So now we have so they're working better than on a market level, and we need to. We can have clinical trials on any kind of cancer. So it's triple negative cancer, breast cancer. So it's much more resident, I would say. It can be used for colon carcinoma, and these mechanisms, they are basic. We don't have any specifics here. So now we're going to the so we have 2% of cancer which cannot be treated, so it's plastic. So in Italy we are working with hospitals, and we experienced it on practice. So not only on cells, but namely on deoxy, and all the medicines which are given today against this cancer. So we're quite optimistic here, and we hope that we will see it in clinical trials. Now let's move to a more interesting topic, but it is not quite ready. It is almost ready. So we have outsourcing in our in our company. So we need to pass to another company for $250,000. So it's the minimum. Sometimes it costs much more expensive. So we can do this experiences on mice, on rats, and so the next targeted drug delivery to tumors. So here we have nanoparticles. So the main portion of all of this is antibody drug conjugates. So these are antibodies where toxins are attached, and it is impossible to give without this. It is not possible. But if they are attached to these antibodies, so we have this that we can kill cancer. So it allows target treatment. So we have many anti-drugs on our market. We don't have any other peptides. So we have for radiotherapy, but anti-drugs, there are full of them, and they are called biological treatments. So we have, let's call them ADC, antibody drugs conjugates. So they usually consist of antibodies and toxins, which is attached through the linker, and linker can be under the stimulus. So it can be PAGs or disulfides, sensitive proteases. So administration is quite simple. It goes to the blood, achieves through the central cytosis into the cell. It just leaves the toxin, and everything happens because of anti-drugs. Don't be afraid. So I want to give the formula. So I just want to show the complexity. But in the one hand, I want to say that it is not quite difficult as it looks. So, for example, 150,000 Dalton, it's quite a big number, but oxygen is only 1 Dalton. So we have different toxins, macrolides, microtubulins. So we have peptides, as you see in this screen, and you see a linker. So it is a long peptide. So we're working on such toxins. So and we conducted everything and also we have other payloads. We have TPO-T and TPO-1. So we're working with peptides because they are working well, and it is really to specialize them. But we have one problem. So the problem with visualizations. So the problem lies in the complexity of the monitoring and analytical blindness. They cannot see what is happening there when they give these ADCs, because it's darkness, complete darkness there. They are working in analytical blindness. And if we could attach any lamp there, like a fluorescence, it will be clear for us what is happening there. So we need to know what is happening inside mice. So we're suggesting theranostics.
And they help to do this. They allow to see in order to define the KPTD, where it goes, where it's accumulated, whether the medicine goes to the cancer cells or to the kidney. If it goes to the kidney, then the kidney will fail. I'll give you an example what's done in the laboratory of ours. We take trastuzumab, that this is the antibody for positive cancer cells. It could be colon cancer or any other cancer. So we attach it to SN38 from one side, and from the other side, where there's the sulfide link, there will be the glutative, which is located inside the cell. It's like a security. If anything goes inside, it takes it out from the cell, and we use it to cut it. That's the known technology, and we didn't invent it. On the other side, do you see the red one? That's the dyer, and it has emission of around 700. It's close to infrared. So it's in the market. It's called ADC, Antitrop-2. It's for breast cancer. And this SN38 here, and it's SN38 there, but that's just a model. It's not the final substance.
Try to finish it on time.
Thank you. Thank you.
A little bit, okay? Thank you. Because of the Russian, you have to... Значит, что мы делали? Значит,
What we do, we use in vivo imager. That's a box which costs around 1 million USD, and then we put the mouse inside, and we see everything what's happening to the mouth, and we inject it, and now we can see how it turns out, how it rotates, and sometimes it is located in the mouse, and we can see what's happening with the mouse. It's a cancer or whatever, and it could be triple negative, and we can see how deep this green mouse, how it can be affected, and how it can go to the cancer cell. And we give once a week to another one, and the cancer doesn't grow at all. And we go further. We can do without a lamp, but you cannot see what's happening inside. You will only see the result with the mouse. How to define the concentration of a medicine. I just show you how it goes, but how much medicine is concentrated in the cancer cells. Maybe it goes inside and it doesn't go out. For this reason, we use the system of 2 dyers. I'll show you how it looks like. There's a video. Let's turn it on. It turns color, or it works like this. One dyer, the green one, shows where it is located, and the red one shows where the medicine doesn't work. And I can show you any time where it goes and what time, and the medicine goes out, and we can see at any time point, and we can determine and calculate it. This is necessary to make the proper linker. Let's go further. Further dynamic therapy. it is injected, distribution, 1 day or 2, and then there's radiation, and then we can see the distribution and free radicals, and it is attached to the antibody, and then the cancer cells are killed. But the problem is we cannot go. We mean the patient cannot walk before it goes inside and localized. And if we see it by color, then it's a damage. We made a safety, and it is only applied in cancer cells, and then there's an active form, and we can get it, and then the cancer cells will be killed, and we can show how much time it takes, up to 20 hours, until it is accumulated, and then it is lightened, and then we can see. After that, then the radiation can be done, and only cancer cells will be killed. That's a purely new technology. It's called like kind of a window, and I'm just show you some results, how it looks like. You can see on the screen. This is our antibody results, and we compared it without the safety, if we need the safety tool or not, and they work very similar. And then after 24 hours, the radiation will not be applied, but we can see how much damage it causes before 24 hours and then after. And we did for this another experiment, and we saw that for the first 4 hours, the first damage was in the lungs. It was immediate. If we apply a radiation not straight away, then the lungs will be damaged. But if we put the patient inside, if we put him in the camera, in a dark one, but nobody wants to do it. It's better to do with a safety. One thing, one radiation for 15 minutes, and then full stop. And then the full radiation of cancer. One injection, one radiation. But the problem is it only goes for 2 centimeters. It's good for mouses, but what about people? But now we work in 30 centimeters. That could be a game changer. That's better than photodynamic therapy. For mice, it's good. But I hope that maybe not fast, but over time it will be better. It depends on antibodies. But for this cancer, these antibodies. For that cancer, other antibodies. Just conventionally. I'm just looking at your faces. I'm a bit too active. I'm looking at you because we're scientists, we are researchers, and I suppose that science connects all scientists. For this reason, I think something is gonna come out with us. If you're going to do anything, we're always ready. That's our faculty. You're welcome to come to us, and thank you for your attention.
Можно одну вещь? Можно от ректора получить?
One thing, can I get a certificate from the rector that my Russian is good? And from my rector as well.
Thank you.
Right. That's it.
Okay, I will now to invite the next speaker, Alma Shukibrakova, the Dean of the School of Pharmacy, Astana Medical University, and she will talk about the prospect of cooperative interaction of participants of the medical pharmaceutical cluster. We're already seeing the benefit of the cluster, already some cooperation and collaboration, and we'll look forward to this presentation.
Уважаемые участники саммита.
Dear participants of the summit, dear colleagues, students, I'm very happy to see you all at this wonderful summit in the walls of our university. And before starting talking about the perspectives of cooperational interaction between the participants of medical pharmaceutical cluster of Astana, I'd like to stop for a while on the work that's been done within the cluster's activities. Within the protocol decree and order, together with the Department of Science and Human Resources, a working group was created and a roadmap was created, and along with this working group, the professional standard of pharmaceutical activity was created. In the process of this work, the working group has done an analysis in pharmaceutics, including the updating of professions, adding new professions and updating the old ones, and updating of professional competencies and other aspects. Based on the above, changes and additions to some of the regulations and orders were proposed, which are specified on the screen. And the results of the analysis were the orient for the development of profession cards, the list of which is represented on the screen. I will not read all of them. The only thing I'd like to stop on the differences between the project developed from the existing one, which is in that every profession card is detailed into professional competencies and the levels depending on the experience and the level of educational programs of qualification upgrade. The second feature is that on the 7th level, on the master's level, first time that the profession cards of clinical pharmacist and radio pharmacist were created. And in these cards of professions will be the basis for new curricula in these areas. The project of professional standard, together with the report for the activities, is handed over to the authorized body for execution, and we hope that the information presented in the report, including the proposals of the working group for changes and additions to the above-mentioned regulations and orders, will not stay without attention. And the focus of these questions is justified with few things. I'd like to highlight a couple of them during the process of work. First of all, on the platform of e-license of the Republic of Kazakhstan, the graduates of bachelor degree of 2023 can get a certificate, and they already received certificates complying to the qualification of pharmacist and manager and specialists for quality of clinical pharmacist. However, these qualifications are specified like the 7th level for the industrial qualification framework. In line with this framework, to get such a qualification, you need to go through the educational program of a master's degree or a certification course, and you have to complete the certification, which is held at least a year, and we as a university, having the necessary staff on all levels of education, on the graduate level and in university level and post-university level, we can guarantee that these certificates, I highlight a bachelor's degree, will allow them to perform the work of a clinical pharmacist when they don't have the appropriate competencies. This is wrong, we think. And secondly, in the addendum to the order, which is shown on the slide, and number 142, there is a list of specialization for certification in healthcare sector. It includes specialties and specializations which require correction. In this chapter, as a specialty, like you see in the screen, there is information and separately highlighted like a sub-article, there is a provisor, and provisor is renamed to the pharmacist in line with 2006, but bearing in mind specialists graduated before 2006 with the qualification of provisor. In the regulation and the professional standard, there is a pharmacist, and in brackets, provisor. Provisor is a qualification, it's not a specialty. That's why I think we need to delete the word provisor. This is a position, a title. And in the column specialization, it is recommended to add a specialty which is called radio pharmacy. Now, let's get down to perspectives of cooperation. The development and implementation of the mutual program for master's degree clinical pharmacy, the preliminary agreement is conducted, and the main thing for the success is that first of all, we think the high qualified staff potential of teachers and specialists of 2 universities and joint educational program on the master's degree of clinical pharmacy is a good step to prepare specialists in the area of pharmaceutics and clinical practice. And its successful implementation will be the basis to improve the quality and prepare good clinical pharmaceutical specialists in line with the international standards. In this regard, I think it's worth to say that by us it was initiated a letter to the Ministry of Health of the Republic of Kazakhstan with our proposals to make changes and amendments to Order 600 to remove complex testing and to change it for the joint program with universities to attract more abiturents, to attract more candidates to enter the universities. The second thing, the usage of scientific platform of Nazarbayev University, in particular, usage of specialized tools on the territory of Nazarbayev University and laboratory to make pharmaceutical surveys. I'm telling pharmaceutical, not pharmacological, like magnetic, nuclear spectrometer. It's a good way to study molecular structure and chromatograph, gas, liquid chromatograph, which allow to make quality and quantity analysis of substances. But it's important to say that for successful implementation to work with the cluster to prepare innovational medicines and to give to the medicines specific qualities and properties, first of all, ready for clinical tests. It's necessary to create mini pharmaceutical production infrastructures with specialized equipment to produce tests of medicines on the basis of our university. To date, this infrastructure is missing for all the medical pharmaceutical cluster of Astana. The third thing, the conduction of before clinical or preclinical tests in biomedical laboratories and modern facilities of Nazarbayev University. The next thing, clinical tests based on the UMC, which is the integrated in the healthcare system of Nazarbayev University. Another thing, participation of our students in more than 250 active scientific surveys due to the web portal of Nazarbayev University. Also the joint management over PhD dissertation and a joint publication of the results of scientific researches. Collaboration with SK Pharmacy is a very important and prospective initiative to develop scientific activities to improve scientific provision for the population of Kazakhstan. The proposed plan includes the following key elements. the joint studies to optimize medicine provision, including the analysis of the regulation documents, marketing researches, organizational mechanism development to provide effective, safe, and accessible medicines and drugs for population, and modernization of national portfolio of medicines by increasing local innovational medicines developed with medical cluster of Astana. Also the support of the producers, of manufacturers, due to the procurement of single distributor will promote the increase of the level of import replacement in our market. The next thing, the implementation of modern approaches to medicine provision within the insurance programs like OSMS and GoBMP, and it includes the purchase of medicines within the state insurance program, and identification of profitable positions of the medicines out of the list, and the standards of medical provision in the inpatient facilities, and the provision of medicines to population, and the increase of coverage of medicine provision. The joint researches in pharmaceutical market with the medicines, and these researches or studies will help to identify advantages and disadvantages, which in due turn will help to optimize the activities of the organization. And the last thing, the joint surveys of pharmaceutical market, including like the analysis of medicines supply, identification of potential risks and deficiencies, and some of the changes in the law and factors affecting for the stability of pharmaceutical market. And summing up my speech, I'd like to say that for your attention, only the main direction of possible cooperation between the participants of medical pharmaceutical cluster of Astana were shown, and all of those directions require a certain specific steps, a more extended identification, and of course all of these will be possible in the working session based on the results of the common and joint discussions and works for all of us. Thank you for your attention.
It's a very good example of that the cluster is a reality, the cluster in Astana. You know, already we're fostering collaboration, clinical studies as well, and training opportunity also in collaboration with Roche, as also mentioned by the chairman of the board of SK Pharmacy. But let's move to the next speaker, because we are a little bit late. The next speaker is Guldaria Mageva. Yes, and she's acting director of the Association of Manufacturers of Pharmaceutical and Medical Products of Kazakhstan, pharma industry, and she's going to talk about the development of the domestic commodity producer and issues of regulation of the pharmaceutical market of circulation of medicine and medical devices. Now we're moving really to the practicality of transferring the innovation and discoveries into real drugs that can be used by the people of Kazakhstan. Thank you.
Thank you very much. Құрметті жиынға қатысушылар, мен бүгінгі осы
Thank you very much. I would like to start my speech with words of Mukhtar Awezov. People and people and nation with nation don't compare. That's why, first of all, for the medicine, and the international summit is the proof of this. And for organizers of Astana Medical University and the rector himself, Kamaljan Talghatulu, I would like to show my gratitude. And our association includes more than 30 medicines and different enterprises, and we have medical companies, around 10 medical manufacturers. That's why, in a practical point of view, we would like to see what kind of questions will be there and what we face on a day-to-day basis. We'd like to show you some results, and I will continue in Russian. Thank you.
Хочу остановиться отдельно на послании главы государства, которое было дано 1 сентября 2021 года. Единство народа, системные реформы, прочная основа процветания страны.
So I would like to quote a message from the head of the state, Kassym-Jomart,
that showed that the problem with virus
dated September 1, 2021, unity of the people and systemic reforms. Systemic reforms are a solid basis for the country's prosperity. The pharmaceutical industry requires special attention. The fight against the virus has shown that this industry has become an important factor in competitiveness and safety. Therefore, it will be necessary to create a center for laboratory and technical testing of medical devices, accredited according to all international standards. Cooperation with global pharmaceutical corporations should be intensified. It is important to attract investors, ensure the transfer of technology and the latest developments. I would like to also quote Mustafa Kemal Atatürk: complete independence is possible only with economic independence. And I would like to say that we have the biggest land borders with Russian Federation. We also are part of the organizations, Western Europe, we're also the part of the international organizations. We also have the borders, we share borders with China, Chinese People's Republic, and Uzbekistan, Tajikistan, and we also have marine borders through Caspian Sea with Caucasus countries, Iran, etc. So that is why probably as a Silk Way, our ancestors in Kazakhstan had the biggest route. So that is why I think it's a sin to not use this situation. Geopolitical position is very important, and we need to take everything out of our geographical location. And I would like to use show you the diagrams. I'm not going to read through. I would like to show you, just point out that we have a decrease just because physical terms and volumes had decreased by 1.4%, and Kazakh was the first hour production during this period, so that is why exactly in this period the decrease is because we stopped procuring international medications, and it is not a secret that protocols of the treatment had been changing. Whole world society actually faced the problem when they didn't know how exactly they should treat this disease. I would like to start from our independence years. If we will start the beginning of the beginning in 1994, drug provision, there was a state joint holding company, Pharmacia, which had 1,832 pharmacies, including 64 hospitals and 1,768 independent medical facilities. By 2023, more than 11,000 pharmacy organizations and 34 drug manufacturers and more than 60 manufacturers of medical devices were introduced. And when I talk about medical equipment producers, are the ones who have a license which proves that they are the medical manufacturers. But according to my practice in the register, we have more than 60 manufacturers with their own medical devices and medical equipment. That is why maybe there might be discrepancies between official data and my data. I would like to know that in my speech, all the information that I have, it's the information classified from public access. So my data is formed and based on Bureau of National Statistics of the Agency for Statistic Planning and Reforms of the Republic of Kazakhstan. In 2022, the volume of production of medicines and pharmaceuticals decreased in value. The reason, I think it's already shown in the slide, the main share of the produced medicine is Shymkent, Almaty, and we have a new leader, which is Karaganda. Karaganda Pharmaceutical Complex is the only pharmaceuticals that produces biological complexes. We have another platform, which is ATAR, where the manufacturing platform has GMP and they're ready to produce biological medical medicine. Here's some of the information on active OTPs. I would like to draw your attention on regulation of the flow of the medicine. You can see the whole cycle from obtaining a license and all of the regulatory norms that exist nowadays whenever it enters to the market. And in order to become the part of the government procurements, which is the more than 50% of our market, it takes 5 years. But if you go to the private market as a private company that doesn't deal with government procurements, then this time is shorter, actually. So retail segment will not demand so much of the control and regulation. The main things what are regulated is the safety assessment, quality, the introduction to the market, as well as the inclusion to the list of the medicine. I would also like to show you the manufacturers, the list of the manufacturers. They're on the slide. One of the main norms that had created an attraction to the investments, it's the long-term contracts. The principles ISCA Pharmacia has two tasks. First one is the continuous provision by the medicine, which works in the frame of the free medicine, and second one is the support of the domestic manufacturer. So in principle, starting 2009 by the government, it had been adopted a law that this mechanism should be introduced. This mechanism has been taken from Indonesia. And if you can see the procurement according to the long-term contracts only increasing, and it is quite obvious. One of the barriers that we have whenever we are regulating the market, it's the pricing. So the control or the regulation of the pricing is quite difficult. Those drugs that are sold without prescription doesn't have any pricing policy. What did the pricing policy give us? What did we gain from it? the mechanism of the pricing is not, it's not transparent. There are no rules. That is why domestic manufacturers has to decline the shipment or supply with some of the medicines. And in a normative act, we have a point which allows a dumping from international or foreign companies. You know, another sin, after decreasing the price for 80%, we don't, since it becomes a barrier. Whenever the pricing is not controlled or monitored, there's another problem that the foreign companies can actually enter to the market without any barriers. So we're talking about it. There is understanding from the government bodies, but unfortunately, we haven't seen the amendments to the legislation. I wanted to show the problems with the price regulation. There are many dependence of market entry conditions and prices of local drugs on foreign drugs, the manual mechanism. There is also late approval of drug price limits. And there are many problems with it. So that is why local manufacturers cannot really compete with it. So that is why we would like to offer, or our proposition is to develop unified methodology for drug pricing, translate the services for registering manufacturer prices into the format of public services, the automatization of the procedures for forming maximum prices for drugs and medical products would be also favorable. Results of non-transparent price regulation of drugs and long-term market entry procedures. It's the 5-year analysis that you can see on a presentation slide. Some of the medicines that are vitally needed, they had stopped their manufacturing because the order had been issued untimely. Hempharm as well, the chemical pharmaceutical as well. For example, company Nobel still cannot be included. Fluconazole cannot be included. And another company cannot actually enter to the market due to this problem. What do we offer? We would like to receive the data PPRI, which is the system for the regulating the prices. There are only 2.
For example, for Kyrgyzstan, for price regulations, so they office and they asked to conduct for them, to write and to conduct for them technical characteristics and data in order to involve price regulations for Kyrgyzstan. So technical specification for price formation. So what can you say about barriers? So what kind of barriers do we have? So the first step is registration, reporting, getting a registration ID for all kind of medicines, and going on, moving to the market.
Entering to the market. And if we will look at, for example, if you are collaborating with Escafirmes, then you don't have to really go through some of the procedures. Another barrier that we have faced is the bureaucracy that we have. Every single year we have to go through the same procedure as the unified distributor, under the unified distributor requirements. It doesn't really matter whether it is innovational medicine or it is the foreign medicine. Patients are losing 5 years. Well, as my colleague Serhat Serkic, for example, have pointed out, nowadays our market already has generics that are covering many molecules and the medicine that are provided by other countries. Now we understand that we need to go further, since through the manufacturing of the generics, we already have opportunities according to the standard GMP to produce on our platforms other medicine and drugs. And one of the world experience is the contract production. I would like to praise ourselves that Pfizer and AstraZeneca all gave us a praise, and they will impress that Kazakhstani manufacturers that goes through the revision, which checks that counteragent is making sure that all of the manufacturing cycles are correct, and they check all of the procedures. They have been impressed by our achievements. We always get good feedback. They always say that they didn't expect this kind of results. I guess it's because the last time, I think it's because of since 2010 and 2015, we started working with the long-term contracts, and we had investors from 2 Turkish companies, for example. Poland company came to enter to the market of Kazakhstan, and in Karaganda we have Russian investors, investment companies, and all of these are new enterprises that have standards of GNP beforehand.
Before closing. Yeah.
Okay. Ну, я здесь
Well, here I would like to, I'm not going to read it out. These are systemic issues and the ways of solution regarding the pricing control. You know, we came to the conclusion that the market, from time to time, we held meetings and we also conduct analysis of the as the MPP, as well as the other committees in the pharmaceutical, and we found support from associations in this regard as well, that in order to solve issues in a systemic way, it is necessary, as in other countries, so that we have a result, it is necessary to have separate government body or unit that will actually regulate production of the medicine. Sometimes, whenever you're working in one of the government bodies and you get requests from the pharmaceuticals, you don't really have time for pharmaceuticals. Here I have pointed out potential risks for Kazakhstan if we won't if we won't develop the pharmaceutical manufacturing sector or production. I'm not going to read it out loud. Thank you for your attention. If you have any questions or maybe comments, please don't hesitate. If you have recommendations, you can send it on the email. I would like to also point out the clinical trials. Most of the times we're facing with the absence of the opportunity to conduct clinical trials. We have to conduct in other countries, as colleague said before me, it's colossal resources and finances and time needed. So that is why I would like to give a message to medical universities and clusters so that they would start dealing with it. We need to try to power through the barriers and resistance from doctors conducting the medical trials in Korea, for example, probably South Korea. In South Korea, probably it's always ongoing process. For the clinical trials, I would like to say that it's a leverage to promote medicine further.
Thank you very much. I would like to comment that within the cluster already we have some collaboration with Roche Holding, and we've been discussing already 2 clinical trials in ophthalmology, in age-related macular degeneration, and this has actually been generated really by the creation of this cluster and a global agreement between Roche and the Ministry of Health. So we are very proactive, and we fully agree with you. We need to bring more clinical investigation to Kazakhstan, and there is a real gap at the moment because obviously geopolitical crisis in this part of the world. So we are really putting a lot of effort.
Yeah. I will add to this. First of all, thank you for your wonderful lecture. But why maybe you can also to bring or to establishing Kazakhstan preclinical trials as outsourcing. It's really, I would say, demanding, and there is a huge demand in the market for that kind of activity. You can work with reduced cost. This is extremely important because if you open this market here, it will be unlimited because any drug in Europe or US or everywhere must go through clinical trials that is done by outsourcing, not in my lab, not in your lab. It's a huge money, I'm telling you. If you can establish it here, it will be a tremendous market.
Thank you very much. So we'll move on to the next speaker. Thank you. Zamagul Nurseitova from the National Center for Expertise on Medicine. So registration of medicine in the Republic of Kazakhstan, every time we have a conversation with the pharmaceutical company, they're particularly interested in how they can register the drugs. That is a priority, because then obviously they can sell the drugs. Thank you.
Уважаемые участники саммита, рада приветствовать.
Dear summit participants, I'm very glad to be here. I represent the National Center of the Expertise of Medicine and Medical Equipment Devices, as well as the pharmaceutical control in the Republic of Kazakhstan.
So, according to the legislation system in Kazakhstan, I'm sorry.
Извините. В соответствии с законодательством.
According to the legislation system of Kazakhstan, so National Center is a state organization in the sphere of medical drugs. So the activity of this center is safety and quality of medical
of medicines. So we are working since 1997, and currently we have a potential for more than 400 staff, 3 laboratories of testing qualities, which are in Almaty, Karaganda, and Taraz cities. In its composition, so scientific center has educational center, which is the base of scientific and practical base for education and for consulting. In 2011, so the Worldwide Health Organization involves one conception of regulations, and in this sphere since 2021 there was a benchmarking of WHO to compare analysis which was spent in 2018, and as a result of these systems, so we had the second maturity. And in 2021, Kazakhstan joined it. And the next step is, the next aim is national. It's to achieve the 3rd level of maturity. And according to the definition of WHO, so the key points in the medical area, so it's availability. And access, timely access, acceptable price, and the main is the rational use of medicals. So based on these components, so the activities of this national center is that the expertise of medicines on state registration and re-registration and amendments to the and evaluation of safetiness and quality which were registered in the Republic of Kazakhstan, evaluation of materials of clinical researches, so conducting clinical investigation as well as bioanalytical part of researches on bioequivalence. So the activity of this center is based on legislation and regulations on codes of Republic of Kazakhstan on health and medical system. Article 71 of state registration. So it is a procedure of on a pharmaceutical market, evaluation of its safety, effectiveness, and including medicals on definite time into state register of medical medicines. In regulations of circulation of medicine in Republic of Kazakhstan, so Ministry of Healthcare in Republic of Kazakhstan, and Committee, Medical and Pharmaceutical Committee of Control. So it implements the realization of regulations on pharmaceutical market, and National Center of Expertise and medicals, and control and evaluation before and after registration. So the conducting of expertise, of expertise, of medicals is carried out with the requirements and rules of medicals, which were confirmed by the decree of Ministry of Healthcare in Kazakhstan since 2002 under the number 10. And according to the data and these rules, so the procedure was defined. So we have regulations and registration and re-registrations and amendments in dossier. According to these classifications, so we can see on some steps. I can stop. So medical is a substance which can be received by chemical or biological substance. So in this case, so we can receive original medical produced molecules which can prove its activity as an original substance. It is compared with the original substances. And to biological medicine, so we get from viruses, from blood plasma, blood tissues and cells, somatic cells, and the last type. So they are not registered in the Republic of Kazakhstan. And some technological drugs as mononuclear antibodies. So each drug has its own vital cycle, and this cycle is created according to the requirements which are needed for medical appliances. So the vital cycle for drugs, they are all phases from the beginning, including preclinical expertise, registration, before implementing to the final entering to the market. On its vital cycle, so social, economical, and demographic factors can have influence on all this and many other factors. During all cycle, so the organization is occurs with the relations as benefits and risks. For registration of these drugs, so an applicant through its own room, so he enters and fulfill all the necessary information. And in National Center for Expertise, so there is an evaluation of the quality of drugs, starting from validation of the dossier on quality and effectiveness and safety, laboratory investigations, and quality and safety and effectiveness. Applicant is getting prepared in the format of common and technical documents, and according to these modules, so as you can see, the module 1 is administrative information, the second module is overview of common technical documents, the third one is quality, the fourth module is reports about clinical researches, and the fifth is a clinical trial reports. And I'm sorry, so the sponsor of the clinical research is has to get an approval from committee and a decree for for permission from the Ministry of Health and Pharmaceutical Control, and after that they can start clinical investigation. In the case of the positive registration of drugs, the organization gives an approval document. It should be registration document for these registration drugs with the data which allows to use it on the territory of Republic of Kazakhstan, and instruction on medical appliance in Russian and Kazakh and state language, technical document on quality and the quantity, with applied number, and of course packs and stickers. Accept national procedure. So since 2018, so there is a legislation regulating the EAEU, which is based on different legislations, so there are agreements and managing principles. So the participants are EAEU, Eurasian Economic Commission, Expert Committee, member states, applicants, and mutual recognition. So after that, they can receive this mutual recognition.
Can I ask you just one minute? Yes. That's perfect. So then finally, last but not least, I'd like to invite the last speaker, Nurgul Aldiarova, the Vice President, the Professional Association of Clinical Pharmacologists and Pharmacists of Kazakhstan. And we'll talk about real clinical practice studies, realities, and prospect. We are a little bit late.
Yes, thank you.
Thank you. Thanks very much. Thank you.
Здравствуйте.
Good afternoon, dear colleagues. I'm glad to see you here.
Саммита. Пожалуйста, презентацию мою можно запустить? Мой доклад посвящен современному международному тренду, исследованиям реальной клинической практики. Вам всем хорошо известно, что золотым стандартом в сфере обращения лекарственных средств являются рандомизированные контролируемые исследования, которые дают нам информацию об эффективности и безопасности лекарственных препаратов. Однако в рамках данных исследований зачастую мы не получаем информацию о долгосрочных результатах лечения, о редких нежелательных явлениях, а также информацию о приверженности пациентов терапии, а также сравнение различных групп терапии. И сейчас регуляторы все чаще одобряют клинические протоколы с меньшим количеством пациентов и с большим количеством суррогатных исходов. Поэтому исследование реальной клинической практики – это запрос системы здравоохранения. Основными терминами являются real-world data – это данные, относящиеся к состоянию здоровья пациента и к процессу оказания.
So the real-world data, they are received from different sources, and real-world data is it's a real clinic practice which we can collect from the data of real clinic practice. In this sphere, so the big success achieved the USA and the so in the last few years, so they had standards of organization of organizations and international experience of RWD. So the European Commission started the project of implementing a European space about the data on health, European Health Data Space, EHDS. So it was started last year, and it was four clinical practice were initiated. as well as treatment of asthma and antibiotics. So on Darwin platform, which will work in by 2024, so we're planning to have 150 investigations of clinical practice. And European Agency on Medical Drugs. So there was an organization which evaluated healthcare system. So there was a plan which should be implemented until 2025, according orphan diseases and many others, and with the usage of AI under the investigation of practice. In international level, so there was no harmonization of terminology. So for pharmaceutical practice, in June, so there was a document on international harmonization of RWE and common principles regarding planning, reporting, and investigation with the usage RWD. Until September, you can leave your comments on this document. So what are we doing? Unfortunately, in Kazakhstan, we do not have any regulations on this research, and in the frame of EAC, so we have amendments in the rules of registration of drugs and GVP and GCP, and these rules are planned and amended. And the concept will be confirmed on collecting, analysis, and usage of clinical practice in EAC. So we have two types of investigations of real clinic practice, interventional and non-interventional. So we have big, simple, randomized investigation trials. So our country unfortunately couldn't participate in this investigation, but we hope that in the future and a database of medical cards. So I think that you know that electronic medical cards are not structured, and sometimes we have low quality, and this is connected with the low level of interest. So we understand that not all the data will turn to the evidence of clinical practice, and that is why for transformation of RVD to RVE, it is necessary to use evidence-based medicine. So blocks were formed. RWE blocks were formed, and it was necessary to have a protocol of research, and there were sources with a good quality. So there was a good resultness. There was a evaluation report and versions of usage of RWE in International Committee of Pharmaceuticals. So clinical practice.
Harmonized protocol template to enhance the reproducibility of the hypothesis evaluating real-world evidence studies on treatment effects had been already developed that will help us out to research the clinical practices. What are the perspectives on the use of the data, applying of data and evidence real clinical practice? Whenever we have post-registrational researchers in the making decisions to include the drugs to restrictive lists or exceptions, innovative models of drug provisions, health technology assessment, making a decision to include drugs to the clinical protocol, post-registration safety, post-marketing effectiveness, as well as the development and study and registration of drugs, registration of new drugs indications, drug dosage regimens. On the slide, you can see the opportunities of the application of the data in the registration case or the dossier, as we call it. And it is necessary to compose the compliance rules. There shall be legal and ethical regulations shall be confirmed.
Sorry, can I ask you to...
Last.
Thank you.
And for the promotion of the researchers of the clinical practice, there should be terminology being introduced into the legislation or being official. And it is important to review or revisit the registration of the patients so that our registrars would be transformed for a user-friendly format. To promote the research into real clinical practice in Kazakhstan, it is necessary to introduce the terms data from real clinical practice, research from actual clinical practice, evidence real clinical practice, international regulatory legal acts, improve legal acts, review approaches to maintaining patient registers, create a single register directory, develop a program or a roadmap for the development of information systemic, scientific and technological platforms. Then also enshrining regulations, the role of data and evidence from real clinical practice, introduce scientific consulting at the planning stage of studies or of real clinical practice, create specialized scientific and educational programs, development of human resources and additional competences, medical specialists in the field of collecting and analyzing data from real clinical practice. In order to go to the RWE, we need to elevate the level of all the qualifications of the workers, for example, in the Ministry of the Healthcare, or they are the ones who are actually composing all of these regulatory documents and the rules. We also need to think about the community, so we have to create a community so that we could have harmonized approach. Thank you so much for your attention.
We have no time for questions, but I would like to really express my gratitude to all the speakers for the excellent presentation and overview. Thank you very much.
Уважаемые коллеги, просим никого не покидать зал. Мы сразу же приступим к церемонии закрытия нашего саммита международного. Наших гостей просим занять.
Dear colleagues, please do not leave this hall. We are going to have a solemn ceremony of closing this event.
Буквально минуту, коллеги, сейчас.
Bear with us just 1 minute.
Уважаемые коллеги,
Dear colleagues, we are starting our solemn ceremony of closing of our international seminar. And in order to, we would like to give a floor to the chairman of the board of directors, the rector of the Medical University Astana. Good evening, dear colleagues, dear speakers, guests, participants, friends. I would like to express my sincere and immense gratitude for participating in this event. I think that we have
our dear guests, we hope that this summit allowed you to find a new professional scientific connections as well as new friends. I hope you received a lot of positive emotion and impressions from our country, our city, and our university. Thank you very much for your having us, for your visit to our university. Роли модели развития.
the roles of the models of the development of structures on the example of the Medical University 21st century in order to be standing at the vanguard of medical education, science, and practice are the key aspects that these seminar and workshop themes were dedicated. And the emphasis was, the biggest emphasis was to engage and involve young scholars and scientists, future scientists. And of course, they will be awarded for that. On the pitch session, the MedTech startup, we had heard a lot of perspective projects. That's the big, let's say, start of our university that will have continuation with by means of collaboration with maybe Ariel University or other universities and other international organizations. Everything that has been done is for the development of bilateral relations, for the development of the medical system, of medicine, of healthcare system, as well as the education system. My colleagues know that during last year, our university has gone serious transformation. And first of all, we are focusing on development of the research area, and all of the reports and presentation that we heard yesterday, the day before yesterday, and today proves our direction and focus. And of course, it is the best opportunity to grow. In order to understand the scale of our international summit, we had 82 speakers, more than 1,000 people were registered as participants, and we have participants more than from 8 countries. We have 2,000 views. These actually proves the intensity of our program. Photos of our more than 3,000 photos by our official photographer had been made. If you will go to our website, everything will be uploaded there. You can get your photos there. And I would like to express my gratitude to speakers from Ariel University, Tashkent Pharmacological Institute, Evangelista, Burkina, Czech Republic, and Lithuania, Bukhara University, named after Medicina, and Mijal Genomics from China, Medical Center, Asan, the South Korea, and also Saxe University from Japan, where had been the done the presentation. Ordinary guy from Semipalatinsk from Kazakhstan who went to Saxe University to Japan and came back here with his breakthroughs. And I think that'll be example for our young students in order to take an example. Our partners, one of the participants of our summit was the Senate Chamber deputies and the politicians, Kazanovations, quasi-government organization, and several ideas had been actually listened by the Kazanovations, and his emotions were so colossal that we decided to frequently meet on this platform in order to implement all of those tasks that they have before their fund, ourselves, and government is supporting by all means so that our researchers will find a niche where they could get sufficient amount of financial aid. Unfortunately, we don't have bright examples of the commercialization and monetization, but I truly believe that these kind of platforms and the meetings will indeed inspire someone, and I think that some applications will be received by all of us. And I would like to express gratitude to those students who were so stoic and was here. Some of them were sleeping here. Some of them gained new knowledge. Each of them got something positive. It's a huge experience for you. Some of you I know since the first year of education, by the way. The big share of the interesting presentations was in English. In English, that is why for all of us we need to, that's the food for thought, to be honest, to learn English, because we know that we have lots of innovational works and we would like to be on the marking point of the different innovations and breakthroughs. That in order to do that, we have to know English language, that's for sure. So with Professor Albert Pinchasov, we have agreed that regularly, at least 1.5 years, we have to try to meet online or offline and try to foster the projects that we have. And this summit is closing, but this is the beginning for our big collaborative work. I would like to express my gratitude, immense gratitude to all of you who traveled long distances. I would like to wish you great and strong health. Let's be united by these kind of events. Thank you so much, everyone. The next floor I would like to give to the rector of the Ariel University, Dr. Albert Pinchasov. Please, Albert. Was not really simple 3 days. You've been so stoic, and you went to our unforgiving, let's say, unmerciless hospitality. Thank you so much. Actually, Rector said a lot what I wanted to say, so he stole my thunder. Well, I'm very glad and very satisfied how conference went. For us, for scientists, being satisfied is to coming here, learning something, and we could create it. Several working groups. This conference, this summit gave impulse for the project, and somebody always comes from our group and says and tells me, I have talked to this scientist about this project, and to that scientist to other project. And I would like to say that we're so impressed with this enthusiasm, with the knowledge that we could see during these 3 days. And I would like to also highlight the panel of young scientists. It was something. We had to evaluate 15 projects. It was very difficult because you were awesome. You were the best. And I'm sure that most of those who are here presenting their works, in the future there will be professors, scientists, scholars. There will be those people who will be leading this country further. And the most important thing is that Kazakhstan could be proud of their own students, scientists, and activists. Thank you so much. Dear colleagues, allow me to start a procedure of concluding, and we would like to give award to Young Forum. Third place award gives to resident of Medical University Astana Jansiit Bekniyazova. Dear colleagues, for third place we give a certificate, we award certificate for 300,000 tenge. Dear colleagues, we have several prize places. Third place goes to student of Kazakh National Medical University named after Asmira Alimi Murtazna. One more third award-winning place in a section of Young Scientist Forum, Associate Professor from Nazarbayev University, Koralay Atagildiyeva. Diploma of the winner of the second award-winning place, I'm sorry. Student to the medical goes to student Pirizat Karabayeva. Diploma for second award-winning place also gives to master student of Ariel University, Moran Kohai.
Победителя секции молодежного первое место с поощрительным призом 300 тысяч тенге сертификат вручается ассоциированному профессору Назарбаев университета Динаре Галиевой.
For Dinara Galieva. For Associate Professor of Nazarbayev University, Dinara Galiyeva.
Нет, мы хотели также отметить.
We would like to notice that all the prizes and awards for young students, so as Associate Professor of Kazakh University named after Asfendiarov, Agata Burska, Scientific Medical School of Nazarbayev University. Colleagues, please come up. Kamila Kukabi, scientific researcher, so doctor student of Astana University.
Medical University Astana.
Гаухар Шентимкаринова, Салтанат Жанусова, Роза Адыракова, Жансирик Бекниязова. Васу Шарма and Tagin Sanak. And we want to encourage with special awards participants of startup sessions, Yedil, master student Rosa Adirakova, assistant of visual diseases department. Irsty Kazikhan and Zarina Kabdralieva. Жанар Адильбекова. And Azamат Jumanov and Imangeli Daurienulы Tastanbekov. Summit is going to be finished. Thank you very much, and I congratulate my congratulations to everybody. I think that everybody of us has gained new knowledge and new experience, and all those students who didn't participate in this session, I think that they will join us next time. Thank you and good luck. Dear friends, one more minute. So we have one of the awards for the most patient person. So this summit had been prepared for 1 year. And from Medical University, thank you for Medical University of Astana for that trust and for conducting very scientific conference, and we want to gratitude the organizing committee from the side of university, Kamaljan Talgatovich, and the chairman of our organization committee, Vitaly Viktorovich, vice rector, who was like a brain of this conference. Gulzira Kinjievna, scientific department. Thank you very much for your patience. Don't we take a photo? Shall we take a photo? And Lilia Ivanovna, the heart of this committee. Vice Rector Bakhtiyar Erkenovich.
I'll accept on my behalf.
I was really inspired with the energy of the chairman of a young committee, Bakhtiyar Ashken. Thank you very much. I wish you good health and good luck. So we have assistants. So we have people who can live unseen, but they do very important conferences. Also, it is Ardak. Akirkiye. All our delegation just fell in love with you.
и салтанат. Ну вот сейчас, наверное, уже все. Всем большое спасибо, счастья.
We're going to finish. Thank you very much.
Уважаемые коллеги, кофе-брейк мы не стали проводить отдельно. После уже церемонии закрытия можете пройти. Да, все.